I'll call to order this meeting of the Sacramento County Board of Supervisors for Tuesday, January 26, 2016, and ask the clerk to please call the roll and establish a quorum.
Yes, Supervisors Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
Cerna.
Here.
McGlashan.
Here.
And you have a quorum.
Thank you. You have a statement to read?
Yes, ma'am. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel, on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. The meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Friday, January 29th at 6 p.m. on Channel 14. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may sign up electronically at the kiosk located in the back of the room.
Okay. Then would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, we're ready for our first item.
Okay. For your consent matters, you have items 1 through 51, and you also have addendum A1 for a resolution honoring Alice Jarbo on the occasion of her 25-year county service award. For item 15, you are introducing an ordinance repealing section 6.99.380 of chapter 6.99, title 6 of the Sacramento County Code relating to detention facilities, fees, and you are waiving full reading and continuing to February 9th for adoption. For item 23, you are adopting an ordinance establishing the schedule of fees and charges for voter registration and elections. You waived reading of this ordinance on January 12th. And for item 39, I need a motion to drop the item. It's the First Amendment to the agreement for on-call building plan check, permitting, and inspection services with CSG Consultants Incorporated.
Do we have a motion?
So moved.
To drop.
I didn't hear the number.
It was item number 39.
Oh, 39. I just heard 9. Okay.
Okay, and I would second it. Madam Chair, if I could just ask to, before we vote on this.
You want an explanation?
No, I know why it's being dropped, but I wanted to ask, when they bring the item back, yeah, I talked with you yesterday, and going back several years ago, we were expecting a report when we made some changes in our structure as it related to particularly building inspection and construction inspection, and I don't know if that report's ever been produced as it relates to filling positions, workloads, and so forth, and it might be that as a complement, again, these items aren't directly related, but I know in talking with you, there was some expectation that we would have that some time ago, and I guess I would ask that we could maybe, that may help give us a picture, certainly as you're reviewing other aspects. Obviously, this is a contract for services being proposed. You're going to drop it and relook at it, but I would ask that maybe you could incorporate that into the to some of the report and information we get back on this.
We will do that.
Okay, thanks.
Okay.
Thank you, Madam Chair.
So we have a motion and a second. Please vote.
Unanimous vote.
Anything else, Madam Clerk?
Nothing for the consent matters.
Okay. Any board member wish to pull an item for question or discussion? Mr. Natoli?
Thank you, Madam Chair. Just quickly, a couple of comments and maybe a question on items 35 and 37, if I could. I don't know if the clerk wanted to read those into record.
Did you want to? Oh, we need to read the item.
Yes.
Sorry.
Yeah.
Okay. For item number 35, it's to delegate authority to the Director of Animal Care and Regulation to enter into contracts during fiscal year 2015-16 with veterinary clinics and veterinarians for community spay-neuter efforts.
And also 37.
I'll read that right now. Report back from the Department of Animal Care and Regulation, interim implementation of the UC Davis recommendations.
Okay. Madam Chair, again, I just would note that pleased to see the items before us this morning, and I know Director Dickinson's in the audience, so I don't know if maybe Dave could come to the podium. I wanted to ask on item 35. This was an appropriation that we had made back last budget adoption last fall, and I guess, Dave, my question is, I'll get to raise the podium. My question is now if we take this action today, delegate authority, how soon do you think you can have the contracts in place? And some of these are amendments. We have standing agreements with folks. And the second part of the question is that with regards to the efforts here, I know that at least with one of the efforts, with the Spay It Forward effort last year, we were able to reach out. I think you did some outreach, as did others, to other organizations, including other cities, if they wanted to participate, because we made this available county-wide, working through Animal Spay Neuter, and certainly with your department. Is there going to be an effort to reach out to folks? I know the City of Sacramento kicked in $10,000. I think Team did. I think Lap Cats, City of Elk Grove brought some money to the table. It would seem to me that effort complements what we all do as it relates to animal services and certainly spay neuter, and we really didn't have any criteria outside that you just had to reside in the county to get your, in that case, it was cats that were being altered. But kind of what's the plan for this year, I guess? That's what I wanted to ask you. So.
Yeah, first of all, good morning, Chairman Glashan and board members. Dave Dickinson with Sacramento County Animal Care. Yeah, we will reach out to those folks. I do know that the City of Sacramento already has an agreement in place with the SPCA. They've given them some monies. I'm not sure what the dollar amount is. I found out about last week for spay neuter of animals with city residents only. Our program typically in the past, the Spay It Forward program, was for all county residents. So we'll continue that. And what we're going to try and do is divide up the funds that have already been allocated by the board between SPCA, ASN, and the SAC group, Sacramento Animal Coalition. So.
And SAC's a voucher program, though, so that's not. So that's. Then you have to reserve the money because you give someone a voucher, however that's distributed.
Right, yeah, we've been in agreement under contract with them for the last 5 or 6 years. We give money from our fees that we collect and our licensing money that we collect, and they use those funds on a yearly basis. So.
Okay. So with animal spay neuter, again, you're going to have the delegated authority to this. Would you be able to enact that quickly? Because I think that one of the things was, I know that, as we come into, into different seasons as it relates to certainly animal behavior.
Right now, the time is of the essence.
Yeah,
so right now, with spring coming up and the cats doing what they do in springtime, that's fine. Yeah, right now is what we needed.
Sounds like people in the audience know exactly what cats do in the springtime. So,
yeah. So yeah, hopefully, if we get authority to do so, we can enter those agreements.
Right away.
First part of next month, if not sooner, as soon as we get them written up. ASN is more than willing to enter into the agreements and perform the services. Okay. And I've already reached out to Rick Johnson over at the SPC as well, and he's very interested and willing to do so as well. Okay, that's good. So just to be clear then, as it relates to Spay It Forward, again, recognizing the city certainly has arrangements with SPCA, and but I know Gina did put $10,000 from city dollars, Gina Knapp did on behalf of the city, into the Spay It Forward. So I do think it would be prudent on our part to do that outreach and to encourage them to participate in that and to provide them statistics, because there were, we did well in excess of 2,000 spay neuters, and it included the entire unincorporated area, but also the city jurisdictions as well. And I think that data, when we go to those folks, would be useful, and it would at least show to them that there were residents from their particular jurisdictions that participated, and hopefully it helped address some of the animal, overpopulation issues in their jurisdictions. Absolutely.
Okay. Dave, while you're there, then, if I could just jump to item 37 real quick. Appreciate a report back, and I know that you've been working in concert with Department of Personnel Services. And so I guess my question is, if you know or somebody knows, with regards to the two positions, the Director of Shelter Medicine and the Director of Operations, it sounds as though, from at least the staff report, that those are going to the Civil Service Commission on March 4th. And there's a process, obviously, to create those positions, to put the compensation behind them, and that would require future board approval. What's the best guess that you have or timeline for actually having, at least in process, the ability to fill those positions?
To actually fill the position, I don't think that would be possible till probably maybe mid to late summer.
Okay. So
It's a process that takes a long time. You know, the positions have to be created, and you have to put together an exam process and put out an advertisement and get your applicants together. So
in the meantime, though, because I mean, when we were here just a month ago and heard the report from the UCD group that assists us with regards, I mean, they made it pretty emphatic in that report, and this board obviously heard that and certainly gave direction to at least go ahead with the steps it would take to create the position. As far as it relates to Director of Operations and the criticality of that position with regards to shelter operations, but certainly to assist you and others in both field and shelter services. And so I guess maybe to Rob or to you, or Nav, is there any way to accelerate that? I recognize obviously it still requires additional board sanction, but
We will look into that, and what we can do to bring
Okay.
these positions on faster.
because you're going to be back to this board in March with an update as it relates to other aspects of that study and the recommendations, and I guess that's not also very far out. We're talking about 5 or 6 weeks at the most, and you'll probably be back to this board. I guess maybe at that time you could bundle that up and see if there's a way to assist in, to do that. Because otherwise, again, you run shorthanded. And if it's that critical of a need, and we can't, again, I think what Dave says is true, can't get to it till August or September, well, that's another, 6 or 8 months. And, what do we do in the meantime?
Okay.
Yeah, Department of Personal Services has been working rather quickly for the last 3 or 4 weeks trying to develop the class specs and stuff. So anything that we can help them with, I'll certainly do. And if there's any way to fast track it, we'll be on board.
Okay. Just a couple of other quick questions, Madam Chair. Just so the Director of Shelter Medicine, though, we have 2 veterinarians, and I guess one of the points that is important, at least in my view, is that that person may be a Director of Shelter Medicine, but they're an active veterinarian, and they're actually performing services, because that's, again, if that report said anything, it certainly pointed to the need for certainly, the aspects of wellness for pets that do come into our care, animals come into our care, certainly the aspects of daily rounds, which is addressed in the report. And it would seem to me that with 2 veterinarians, you need the third person to be practicing. They may be the director, but that they also need to be very involved in day-to-day aspects of surgeries and wellness and and spay neuter and all the things that go with having a well-honed operation that really tends to the needs of the animals, both in our care, but also as we're working with the community on spay neuter efforts and other outreach efforts. And so I don't know what the position is going to look like, and I won't second guess that, but I would just say that when you're back before us, I don't know what you're taking to the Civil Service Commission, but that needs to be clear that it's not just somebody that's going to handle the paperwork and tell 2 other professionals what to do on a daily basis.
Yeah, that's part of the qualifications that they'll need to meet. They'll have to have a medical license, doctor of veterinary medicine license, and they'll be able to practice medicine in the shelter just like the other 2 veterinarians.
Okay, and I think that would be just a clear expectation for that. So, all right. And then one last question. Then I know I got the answer before we started here that apparently the tablet computers that will assist with the daily rounds have arrived as of last Friday, and that those will be distributed. So we will be instituting that on a daily basis then with the hardware that's arrived and with the personnel and some of the test runs you've done, Dave? That's
correct. Yeah, we just got the tablets late last week. I got a chance to look at them yesterday for the first time and fired one of them up. It does have Chameleon on there, so we'll be putting those into implementation. We've got to make sure that they're in a secure area on the med card as it goes around the shelter, and so they don't walk off. But yeah, we're looking at that.
And maybe you can give us an update on that when you come back in March then as to how that's
absolutely.
going and what it means for the animal welfare in the shelter. Okay. Thank you, Madam Chair.
Okay, thank you.
Thank you.
Thanks, Dave.
Ms. Peters, did you have anything today? Mr. Cerna? Mr. Kennedy? I don't either. We do have a request to speak on item 22. Susie Dotson.
Morning.
Good morning.
Thank you, Chair McClashin and the rest of the board, and thank you to the staff. I really wanted to speak to the board to express my appreciation for the Sacramento County staff and how hard they worked to get this program on the agenda, and also to all of you. I'm encouraging you to approve this. WIND served 917 unduplicated youth experiencing homelessness last year at our drop-in center, and this transitional housing program will give some of these youth a real chance to reach their employment and educational goals towards their journey out of homelessness. I really appreciate Sacramento County's dedication to youth and look forward to making a real impact on youth homelessness in Sacramento.
Thank you.
Thank you.
I have no other requests to speak, so a motion is in order on the consent calendar. Second. We have a motion and a second. Please vote.
Unanimous vote.
Okay, and our next item.
Madam Chair, you also have Addendum A2.
All right, thank you.
It's a service award honoring Alice Jarbo on the occasion of her 25 years of county service.
We have a motion on that?
This is just a presentation. It was also included in your consent matters.
Okay.
And this is a presentation.
Oh, okay.
Okay. I just want to thank, good morning, board. Thank you 133 days, by the way. I want to thank you very much to be part of this presentation to honor Alice on her 25th anniversary with the county. Alice actually started her career right here in these chambers. She was a deputy clerk at one time, and she worked for Cindy Lee, so has a lot of history with the county. And I'll ever be grateful that she was when she promoted to an ASO2, that she actually came to our office and she started working with our budget. And in true Alice fashion, she always has another question. So in order to know more about the budget, she started asking all about elections. And with that knowledge, she quickly promoted to being an election manager and then to being the assistant registrar. I couldn't have a better registrar or assistant. She produces very detailed quality work. She takes those angry phone calls. She deals with those irate people at the front counter. And she not only anticipates my needs, but she anticipates the needs of the entire office. And she's truly a champion for those needs. Alice is my coworker and my friend. And during the busy election season, I'm sorry, Tim, but we spend more time together than we do with our families. So thank you very much, Alice, for all your hard work and for these 25 years.
It's gone by really, really fast. When I first started at the board, people had been there for years and years, and I just thought, oh my gosh, how do you stay somewhere for 25 years or 30 years? And, you know, I woke up recently thinking, oh my gosh, that's me. I've been there for 25 years. I'm old. And it's like, where'd the time go? But when you're working with great people and when you have a great job, an exciting job, the time just flies. So it's been really fun working here. Thank you.
Thanks.
Thank you.
Item number 52 is a presentation of resolution honoring Kurt Codwell upon the occasion of his retirement.
So if Kurt could please join me at the podium. Morning.
Thank you.
So I have a very large resolution to present to you from the Board of Supervisors in recognition of your retirement from the Office of the Assessor on January 30th with more than 30 years of honorable service, and they asked us to put this in, limited functional obsolescence. Maybe you can enlighten us on that in a few minutes. You were first employed with the county in 1983 as a student intern in the planning department. have a Bachelor of Science degree in Business Administration from Sac State, and earned a scholarship from the Society of Real Estate Appraisers to further your studies in pursuit of your career goal to become a real estate appraiser, and you were hired by the Assessor's Office in 1985 as an assistant property appraiser, promoted to Real Property Appraiser 1 in 1985 and Appraiser 2 in 1986. As the direct enrollment analyst, you proved that no assignment was too difficult, demonstrating you possess both brain power and brawn by overseeing the valuation of thousands of residential properties, employing regression analysis by day, and being named the MVP of the Assessor's Office softball team after hours. Sounds like a Renaissance man to me. You attained certification from the State Board of Equalization as an advanced appraiser for property tax purposes in 1990, received a commendation award in 1991 from the County Suggestion Award Program, and were subsequently promoted to Associate Real Property Appraiser in 1991, and in 1995 received the Department's Quality Recognition Award for your involvement with the project that created SAC letters for residential permits. You were promoted to Senior Real Property Appraiser in 1997 and Supervising Real Property Appraiser in 2003, Chief Real Property Appraiser in 2007, and since then have successfully managed multiple divisions and sections in the Assessor's Office. And now will be free to spend more time with your family, troll the waters of Northern California lakes and Delta bass fishing, and have your retirement check directly deposited at Fisherman's Warehouse and get lost in Bass Pro Shops. So therefore, the Board of Supervisors honors you on the occasion of your retirement and extends our sincere appreciation for your many dedicated years of service and wishes you a happy and healthy retirement in the years ahead. So this is your opportunity to say a few words.
Very few words. I think people.
Some of this needs explanation.
No, I think it's just perfect. Just a quick note of thanks. It's been a wonderful 30 years working for Sacramento County. I appreciate all the help I've gotten from the board in the past and from some of our other county partners. The Assessor's Office has been a wonderful place for me to grow, and wonderful people, and I appreciate the peers who took the time from our busy work day to come out here and recognize us. And thank you all for your time too. Appreciate it.
Thanks.
Take a photo here.
She's coming.
Yeah, we can. Yeah. Once again, congratulations and enjoy your retirement.
Madam Chair, before Kurt leaves, if I could, Kurt, just before you leave, I kind of tickled me when you said that all the help you got from the board, because usually when my office or when I would work for Toby, when our office called, it wasn't calling to offer you help. It was it was because either somebody called us about a matter of their assessment and or some other issue. But I would just say that over the years, certainly not on a real frequent basis, but sort of had the opportunity to work with you. And I do recall early in my career as a board member, when we, and then Ken Steger was our assessor. I remember a couple of meetings with some of the farmers down in the South County about the assessed valuation for some of the crops and some of the other aspects, and they were a little testy. But certainly you and your colleagues and Assessor Steger, but certainly in more time, recent time, Kathleen, have always been very attentive. I think certainly to the responsibility you have to make sure that properties are given fair appraisals, fair assessments, and that we fairly apply by the property tax code, but also that we treat people in a way that's respectful, and sometimes it can be very complicated. And I know you were, again, from time to time called in to, put out a fire or two, and I want to just thank you for that, for your work on behalf of the people of Sacramento County. And, I think that everybody recognizes we have an obligation to pay our taxes, but I think also that there can be a lot of questions, and when, the evaluations ride the ups and downs of the economy and so forth, keeping track of that and all the various sundry parcels and all the various aspects of making sure that the stuff is done properly, you've certainly been a leader in that regard, and I know respected obviously by your colleagues in the office. And 30 years passes pretty quickly. Just to hear Alice a moment ago, 25 years, again, I remember when she started with the clerk's office, and but I think it speaks to dedication and certainly your willingness to really work hard and to do your job, but also to, I think, build a camaraderie. Is important when you have a team of folks that is given an assignment. And there's been lean years, and I know you folks have had to tough that out, and again, you've been there through that, as well as obviously in a little better time. So I want to thank you for your work, though, and really appreciate your service to the people of this county, and just remember that the worst day fishing still beats the best day working. So
Giddy up. Thank you very much.
I know Mr. Cerna has something to add as well.
I want to add to what Supervisor Tolley has mentioned about your service here with the county. In particular, I want to point out the fact that in the 5 years I've served on this board, believe it or not, the five of us don't work independent of a lot of assistance in each of our respective district offices. We have tremendous staff that work with us, but that work hand in hand with a multitude of agency-specific great staff in this organization. And my staff in particular wanted me to make sure that I extended my personal appreciation to you for your service and your help with various District 1 issues over the years. And as Don just mentioned too, as a fellow angler, I wish you well out in the water, and just be glad that you didn't get a fishing hat.
Although we could.
That's okay.
Thank you.
All right, thank you.
thanks, Kurt.
Thank you again. Next item.
Item number 53 is the 2015 Employee Giving Campaign Report back.
And it looks like Mr. Leatherman is taking the lead here.
He's a florist today.
Did those come from the county parks?
They did not. Those are not native. Again, Jeff Leatherman, Director of Regional Parks, and had the pleasure of being the chair for the Employee Giving Campaign this year for 2015. And just want to celebrate an opportunity that the county allows and the Board of Supervisors allows the department to chair every so often, and this last year was our opportunity. And it's really a team effort. And the reality is our campaign chairpersons, myself as the chair, Terry Porter from Child Support Services, Connie Ahmed from Revenue Recovery, and Lori Moss from Community Development. And they will rotate into my position as the chair. And they allow the following staff, our loaned executives, really the time to lead this campaign over the course of about 9 months. And I'd like to invite Amber Vaselko from the Department of Regional Parks, Adrian Roseman from Child Support Services, Elizabeth Hudson from Revenue Recovery, and I know Carrie couldn't be here, Blakowski from Community Development, but Lori Moss is here just to celebrate their effort. And they lead a team of people throughout our county, our chairpersons throughout all of our department buildings, throughout all of our department facilities, really in the opportunity in October to raise money for charities throughout not only Sacramento County, but also throughout the United States and even broader than that. Support services along with children, clean water. I mean, the list goes on and on and on. And it's really a team of people that make it happen. So to celebrate that this year, for the 2015 year, we were able to generate as a county, $265,000, just over that for the 2015 year, which is an outstanding number, a huge undertaking by our staff, not only through the e-pledge system and Federation donations, but our donor choice pledge, our department fundraisers, and then the 5K fun walk that we have down in Discovery Park. So with that, I want to just provide a small token to our representatives here, some flowers and a certificate of appreciation, but also want to invite the board members to celebrate with us by taking a picture with a big check, which is always fun to do. But any comments that you may have before we do that, it would be much appreciated, and thank you for allowing us the opportunity to serve the county this year. And the people that come behind us will have their work cut out for them, but my staff was always happy to help and support as we pass the baton on for the 2016 year.
Thank you, Jeff. Mr. Cerna?
Yeah, Jeff, and certainly to the other, I guess, co-chairs, I'm really blown away by that total number down there. That's quite a feat to raise more than $250,000. I know we have these presentations annually, but it never ceases to amaze me the generosity of the people in this organization. So I just want to extend my thanks for a job very well done. Each of us engages in various fundraising activities in the communities we represent each year for various charities, but this is pretty remarkable. So I want to thank you all for great work.
Thanks.
Anyone else? Ms. Peters?
I guess it's a ditto to that. In the time I've been here at the county, I've always been really happy to be part of an organization that is so generous. Every possibility for the county employees to contribute to help other people, they've always come through. So I congratulate all of you on raising such a huge amount of money.
Yes.
Thank you.
Thank you.
Thank you very much.
Madam Chair?
Oh, would you like us to?
We would really appreciate an opportunity if there's, is there any other comments?
Mr. Antoli, sorry.
Yeah, well, we'll go down and take a picture. I just would ditto what my colleagues have said, and I know that through thick and thin that the campaign goes on, and that in some of the tough years, this county, those employees that remain with this organization, dug in their pockets to continue to support, worthwhile efforts both in this community, but more broadly, certainly things that are important to them and to their families. And as both Phil and Susan said, I think the generosity is something to really behold. I think it speaks to the caliber of people that work for this organization, certainly to the leadership that each of you and your predecessors bring to the effort. Because again, you have to carve out of your, time for nearly a year. The time to do this, to pay the attention to provide the organizational structure that really lends itself to a strong campaign and to the bottom line that we're going to recognize here in a moment. So again, thank you to all of you and certainly to all the county workforce who again step forward on a regular basis to put money back into this community for some very, very important and worthwhile efforts that help make for a better life for people and for all the various aspects of the environment and the animals and children, and you go right through the list of all the things that people can give to, and it makes a big difference. So I add my thanks to the thanks that have been offered already.
You bet. And we have our department totals, and sometimes it gets a little competitive within the county, so we also have our Tier 1, Tier 2, and Tier 3 totals of the money raised throughout the different divisions of Sacramento County. So that's also represented there based on the number of employees.
It's very impressive.
Yeah. And if I could just invite the board down, we also have the big check, and I know we can't fit it into an ATM, but we give it our best. So.
Well, I think those machines just need to have bigger slots.
That's right. Thank you, sir.
Thank you so much. We'll display this.
Oh, that's true.
Which department?
Since apparently we continue to like to brag about our departments, and Lori reminded me that her department has won the fun run over the last 2 years in a row now. So, thank you, Lori. Well done.
You start training now, Jeff. You get out there and lead your team next year.
Right. We'll get them next year.
Okay.
Thank you, everyone.
Thanks.
Okay, we'd like to call the next two items together.
Okay, so for item 54, it's the report back from Sacramento County Medi-Cal Dental Advisory Committee, and item 55 is the presentation of the updated study of dental geographic managed care for Sacramento County children.
Good morning.
Good morning. My name is Kate Veronelli, and I'm the Vice Chair of the Medi-Cal Dental Advisory Committee, and I'm also the Dental Health Program Coordinator for Sacramento County's Dental Health Program. And today I'm going to report a little bit on the committee's activities and their goals. In 2012, the State Budget Committee authorized the formulation of the Medi-Cal Dental Advisory Committee, and the purpose of the Medi-Cal Dental Advisory Committee is to provide oversight and guidance to improve dental utilization rates, the delivery of oral health and dental care services, including prevention and education services through dental managed care and fee-for-service Denti-Cal in Sacramento County. I'm not sure how to change the slides here, but let's see. Okay, I got it. Okay. So our members are a diverse group, and they represent many stakeholders. And I have to say our group of members, because they are so diverse and so dedicated to what we're doing, it's really a pleasure to work with this committee. I don't think I've worked on a committee that is so intense as this one on these issues. While the utilization rates in Medi-Cal beneficiaries has increased since the inception of MCDAC, I call it MCDAC, that's Medi-Cal Dental Advisory Committee, it still needs improvement. Several statewide items of interest occurred since the last report that I think I should note here. The first one is the Denti-Cal internal state audit, and then, of course, the request for the Little Hoover Commission to look into the Denti-Cal program. And then the third thing is the hiring of the state dental director. The internal state audit found a number of weaknesses that are being addressed by the Department of Healthcare Services. Among those were there was no established criteria for assessing utilization under the fee-for-service program. And while overall California appears to have an adequate number of active providers, some counties lack any active providers for children in Medi-Cal. DHCS failed to monitor the Denti-Cal system. Annual reviews of reimbursement rates were not done in more than 10 years, and California has one of the lowest reimbursement rates in the nation. 35% of the national average for the 10 most frequent paid services are paid at 35% of the national average. Data collection is insufficient to meet federal and state requirements. DHCS does not collect sufficient detail on the number of children receiving specific types of dental services, and an increase in individuals from 2.7 million to 6.4 million possible with recent federal and state law changes. And that's what we are expecting Medi-Cal to serve.
And you might want to advance your slides.
Oh, sorry. Okay. Okay, thank you. Okay, the second thing is the Little Hoover Commission. A letter of request was sent in April of 2015 from Senator Pan and Assembly Member Woods to the Little Hoover Commission to look at the Denti-Cal program. The commissions, there were two public hearings that were held. One was held in September, and that focused on the current issues faced by Denti-Cal providers and participants. The second one was held in November, and the commission explored possible solutions and alternatives to the problems currently experienced in the Denti-Cal program, including targeted reimbursement increases, a greater emphasis on reaching the underserved in their neighborhoods, and the dynamic between funding preventive versus restorative care, and ideas for emerging dental technologies. The commission also heard testimony about the needs of the adults in the Denti-Cal program. Representatives from the regional centers gave testimony about the challenges faced by disabled adults. Several disabled adults and their parents attended, with parents explaining the needs and challenges of dental care for the disabled adult children. The study results are anticipated in the spring of 2016. So we look forward to seeing what else is found out. The third thing is the state dental director, which is something that has been in the works, trying to have a state dental director in this large state. Dr. Jay Kumar was appointed in August of 2015 as the state dental director in the California Department of Public Health. Dr. Kumar was recently the director of the Bureau of Dental Health at the New York State Department of Health, where he served in several positions since 1980. He's the chair of the Association of State and Territorial Dental Directors Perinatal Oral Health Committee, and a member of the American Dental Association's National Fluoridation Advisory Committee. Under his direction, several work groups have commenced to create a state oral health plan by mid-2016. Both Dr. Jones and I and myself have been participating in these work groups. The next work group is going to be held Thursday, the 28th, at Sarah Health Foundation. So moving on to MCDAC's accomplishments and activities. The increased utilization for children ages 0 to 20 from 20% in 2008 has increased to 39.6% in 2014. Continued partnership with the dental plans to provide training to new family resource center staff on accessing dental care. And that includes how to make dental appointments, the location of dental clinics and providers, contact information for all the dental plans, and contact information for the state hotline for dental services. And training dates were held in September, October, November, and December. The committee has also supported the virtual dental home, the implementation of AB 1174. Individuals who are MCDAC members and others who regularly attend our meetings participated in both of the Little Hoover Commission hearings. MCDAC members and the participants were called upon to provide assistance with the updated study of dental geographic managed care for Sacramento County children, of which you will learn about in Barbara Avid's presentation. MCDAC members continue to provide input to DHCS through stakeholder input, process, and conversations at MCDAC meetings. In 2016, the committee will continue to improve utilization rates. It remains a top priority. Increasing access, including outreach to beneficiaries and outreach to providers. To work with DHCS on data transparency and timeliness of reporting. Reporting by DHCS of data is essential to any analysis of the data that we receive. To develop a richer partnership with DHCS, providing input and recommendations, continuing open conversations and interactions, and encouraging their presence and participation in our MCDAC meetings. Continue working with dental plans on outreach and patient education. The dental plans have worked together in 2015, and they have explored school-based programs. The committee supports the virtual dental home model and wants to explore options for a virtual dental home project in Sacramento County. The dental plans have expressed support of the virtual dental home concept and will be looking at options for implementation. Patients who need care under general anesthesia continue to have issues with access. MCDAC will continue to work on hospital access to care and streamline general anesthesia policy guidelines. Support partnership with the state dental director on possible projects or funding for Sacramento County. And to continue to monitor impacts of increased Medi-Cal beneficiaries, both children and adults. And so those are our goals continuing in 2016. Does anybody have any questions?
Yes, I do.
Mr. Cerna.
Thank you, Madam Chair. I was going to hold my comment and question to the end, but I don't know how close we are to the conclusion of your presentation. But first of all, let me thank you and everyone in the MCDAC for all the great work you do. As chair of the First Five Commission, I'm pretty familiar with the effort. In the board letter, and because you just mentioned it, there is a list of the goals for this year. What I don't see in the goals is something that I would suggest you give a lot of thought to, and that is a numeric target. Granted, getting from 20% to 39 point whatever it was, 39.6 utilization rate, that's terrific, but it's completely unacceptable, and I think everyone in the MCDAC would agree. So what I would ask you to respectfully ask you to think about is maybe setting a target of 10% increase per year for so many years, or some other numeric percentage target, because ultimately that's the principal goal of all of this. And granted, I know there's a lot of other kind of sub goals that you've mentioned, but ultimately that's what I think this board is going to be most interested in. Certainly, the First Five Commission is going to be very interested in understanding how we're getting to a utilization rate that we can be proud of in terms of the intervention that the MCDAC has provided. Otherwise, I'm not convinced that we're doing everything we can. I know it may be tough, but I think having some kind of percentage threshold as one of your goals, and I would not want to get too much into the details about how you would set those goals, but I think it's important that you have something in there that references where you want to be, where we want to be in terms of utilization rates by a certain time.
And that has been a discussion of ours of really what is an acceptable percentage. And I'm not sure, but I'm pretty sure that Barbara has some of that information in her report of what nationwide is going on and where we are.
And where we are compared to the rest of the state, the other counties, right?
Okay. Mr. Natoli?
Yeah, I want to thank folks for the presentation and the written material, and obviously report by Barbara is very thorough and it's updated. But I was just thinking that it's approaching 6 years ago when we had quite a stormy hearing, certainly in these chambers, as related to the dismal utilization rates, and access, and again, out of that, obviously, has come the committee structure, sometime later, and I think the tracking and certainly First Five has been a part of this. I guess, as I read this, and again, I certainly want to acknowledge the advancements. I think, a lot of it's done with percentages, but those equate to real people, to children, different ages, and certainly their families that are, finding access, but hopefully getting their particular dental issues addressed, and if nothing else, getting regular checkups and hopefully avoiding much more severe consequences that can not only impact, obviously, their dental health, but can affect their physical health and emotional well-being as well. But my question is that I think there is still either a lack of willingness or a lack of understanding, or maybe a combination of both and other things with our legislature and with our governor. If this is a priority as it relates to health, certainly of families and of children that we're talking about here today, to look at the reimbursement rates, and it's all outlined in here without getting into all the detail. And I guess the thing that really kind of jumped off the page to me is that in page 3 of the summary, in one of the bullet points, it says the supply of licensed dentists is ample in the county, but nearly 90% of dentists do not see children with Medi-Cal. And then you did a survey of that 90%, or at least a sampling was done, and half of them said that, if there were higher reimbursement rates and payment was made on a fixed fee basis and reduced administrative burdens were incentives, might entice them to come back in that direction. And yet, in the other half, again, 45% of all the dentists said there was nothing that's going to entice them to do this. And so, to me, the challenge is big. And again, that's a matter of choice. They're professionals, and they may, be able to, certainly address others' dental health needs through their, private practices or group practices and so forth. But, there is a systemic problem here, certainly in the state of California, but it affects us in this region and those folks that we immediately represent. And I guess for all of our best efforts into what Supervisor Cerna said, to have goals and so forth, and I think we made some strides. And I want to credit certainly the work of the committee and others, professionals in this community. But unless there's a willingness by folks in the legislature and right up to the governor to take this on, I don't see that you're going to, to this discussion about being plateaued and so forth. I mean, you're incrementally make some improvements. It's going to continue to be a problem for access and for for all the reasons. Then you talk about the patients, the reactions to negative interactions and so forth, and that all has I'm sure a whole bunch of tales behind it. But to me, what needs to be done is that the folks need to wake up, and I appreciate Senator Pan's advocacy, and certainly he's consistent in that regard, and we'll see what the study says. But either they got to come to grips with this, otherwise our task is going to continue to be monumental, and we'll show incremental improvements. This is my take on it, but the ability to actually get a large proportional share of young people and families enrolled and access and actually get their needs attended to, I think it's going to be extremely, extremely difficult. And we're better positioned here than obviously in some of the other counties where they don't have any access to any care because there's nobody available to provide those services. And so I think certainly the GMC model, and the work of the committee and certainly of our consultant are helping, I think, advance the understanding. But I guess I see as this is just a very big undertaking and task unless we get some recognition across the street about what they need to do statewide to help us in our own communities. And so anyway, that's kind of my takeaway. And I would just, any comments that either way you want to add, I appreciate it.
And hopefully, through the internal audit that was done and some of the changes that are being made at the state, hopefully that's going to impact, the services that the Deni-Cal beneficiaries receive. I think it's a starting place. I really do. I think there are really some internal problems and things that need to be corrected before we can actually really move on and make sure that all the children are receiving the care that they need to get. And I have to say that the general anesthesia, to me, that's a very, very big issue. And there's, like I said, the committee that comes together all the time, biggest hearts, most dedicated people wanting to get these changes done. So we're working on it.
I know. Well, again, I credit you certainly your efforts. I mean, this is positive in that regard.
Good morning. I'm Barbara Abed with Barbara Abed Associates, and we have a slide presentation.
Oh, we're not there yet. We still have a board member question.
Excuse me.
Ms. Peters?
Yeah, thank you. Could you come back, please? I wondered if you were aware, and if you're not, this is going to catch you cold, that the California Dental Association sent us all a copy of a press release today urging the state to end this 20-year pilot because the utilization rates are so low, and I guess Fresno has a fee-for-service program that's costs less money per child. And it's suggesting that there's a new Medicaid waiver, 1115, that they think would be better. And I don't know what the Medicaid program is, and curious if you have any comments about it. Realizing I'm catching you cold, maybe. I don't know if you saw the press release.
I don't have any comments about that. I think that would be something that we could discuss at the McDAC meeting and bring something back. On what are
okay. Do you know anything about this Medicaid program that it suggests?
Can someone else answer that? I'm not real sure. Okay.
Yeah. Okay. I think some of your questions might be best answered with our presentation, and I'd be happy to answer that particular question.
I didn't realize we had another presentation.
Yes,
sorry.
number 55.
Oh, the next item.
The next item.
Okay. We'll be reporting to you on the status of the Sacramento County Geographic Dental Managed Care Program, which is in fact driven by the state's larger Deni-Cal program, and that's California.
Okay, why don't you wait till we call the next item then?
Okay.
So, thank you.
I'm Julie Byers. I'm the staff to the Medi-Cal Dental Advisory Committee and also the Oral Health program planner for First 5 Sacramento.
Working on it in the-
With regards to the Medi-Cal, the 115 waiver, what the state has proposed in that waiver is some innovative dental programs. Unfortunately, I don't know the detail on all of them. We have been invited by DHCS, Dr. Jones and McDack, and I have been invited to meet with the Department of Healthcare Services regarding that waiver and the innovative ideas that they have, and we just don't know exactly what they are yet. But
So
we're
it would
hoping.
be competitive to this program, or
I believe it's
possibly replace, or
I believe
in
it's
addition to?
I believe they're trying to enhance the existing program, and they're trying to do. Usually, Sacramento County, because we do have this active Medi-Cal Dental Advisory Committee, they do sometimes let us know about things that are going on, and so I believe that what they're trying to do here is to get us on board with whatever they are planning, and/or look to us for some ideas with regards to their innovative programs for the upcoming 5-year period.
Thank you.
Okay, I'd like to thank the advisory committee for your service and also for your presentation, and then we'll move on to item 55. I have no one signed up to speak on 54, only on 55. And I also need to let the other board members know that I currently have a blank screen in front of me, so we're going to have, until that gets brought back up, we're going to have to work old school here. So,
okay.
So yes, like to give us your presentation now.
Good morning.
Morning.
We were asked to do an original study in 2010, which we presented to you 5.5 years ago, about the geographic managed dental care program in Sacramento. At that time, my opening sentence to you was, I hope you are as appalled as I was by the data that I'm going to present to you today. Today, 5.5 years later, I don't need to say that because, in fact, there have been many improvements in the program that we're going to be talking about. But like anything, we can talk about it as the glass half full or the glass half empty, but I'll be talking to you about both. All right, well, this works.
And you are Barbara Avid?
I am Barbara Avid with Barbara Avid
okay.
Associates.
Thank you.
And we're a health consulting firm, Sacramento-based, and about 1/3 of the work we do happens to be with oral health projects. The purpose of the study, again, was to re-look at the program 5 years later to see what improvements had been made, and we basically looked at the same features of the program. We also paid a little more attention this time to what other states were doing in managed care or in innovative models that California might consider to replicate. We worked with a group from the McDack, an advisory committee who steered this particular project. The way we went about it was very similar to the way we did it before. It was very data heavy to the extent that we were able to get data from various parties, as you would imagine. We conducted interviews with not only other states, as I mentioned, but with some of the dental offices in Sacramento County and with key experts. We also were able to take advantage of a couple of opportunities to do surveys, one of which was with GMC family members, which had not happened before, as well as a survey of the local dentists. And we'll talk about that in a minute. And then, of course, we looked at other studies that had been published. We looked at, and we've been asked about this, well, why were you looking at the larger state Denti-Cal program when in Sacramento it's really all about managed care? And that's because the state's Medi-Cal dental program is what drives your local program. The policies, the procedures, the reimbursement rates. Sacramento either benefits or suffers as a result of that particular program and its structure and its deficiencies. So Sacramento GMC, and this is primarily 2014, where our data come from, you have about 150,000 kids who are eligible. And let me comment here. We were looking at only children, even though the adult benefits were restored partway through 2014, because we wanted to be consistent with the earlier study. If this study is done again in 3 years, which we do recommend, we think it's then time to look at both adults and kids. Anyway, about 90% of the kids who are eligible for Medi-Cal dental benefits in Sacramento are in fact in the GMC program. The other children don't need to be because of their particular, aid categories, but they can choose to be, and many of those families or caregivers choose to enroll their kids. You can see with the pie chart that the 3 managed dental care plans have a portion of the enrollees. 5 years ago, there were 5 contracting plans. Our recommendation at that time was to terminate the contracts with the lower performing plans, and that's in fact what happened. So the McDAC committee that you've certainly heard from over the last couple of years has been one of the keys to success, because in their monthly meetings, in their subcommittee meetings, and the meetings that they hold with the state, very, very detail-oriented in trying to make a difference in this particular program. I won't go into any detail since you heard their report. So in terms of some of the improvements, again, we can say, well, gosh, utilization is only 39–40%, and that is not good, and nobody should be happy with that, quite honestly. However, it doubled from 5 years ago, so it jumped 100%. And more impressively, to me anyway, one of the big surprises was the little kids, the 0 to 3 kids. That jumped 250%. Not where we want it to be, but that's a tough age group, because we're talking about families understanding and following through with the recommendation that the child have its first dental visit by first tooth, first birthday. And by the way, the efforts locally have really paid off. The local dental society, the Smile Keepers program, all of the people who have worked with the dental offices, the dental plans, working with their provider offices on that campaign have really paid off, because you'll see in one of the slides, the dentists who participate in GMC, a very large portion are now seeing kids as young as age 1. That was not true 5 years ago. Overall, there's a more positive view of GMC, including by the local dental community, particularly those who participate in it. And the network plan capacity has improved. Well, the glass half empty portion, what still needs to happen? There's still a lot of work that needs to happen, even though we have a structure in place, and even though the state has said that dental is a priority, there's still things that have to happen and pay attention to. Our utilization rate lags behind many other states, behind the national Medi-Cal or Medicaid average. 2/3 of the kids who were paid by the dental plans were paid for the children, did not receive a preventive service. Now, preventive service is a particular category of service, unlike, say, screenings or treatment. And that's a real deficiency that has to be improved. Now, recall that one of the structural improvements in this program was that the department, following our recommendations from before, did institute 11 benchmarks, performance metrics and benchmarks, to which the plans are either rewarded if they meet benchmarks or penalized financially if they don't reach the benchmark. And so clearly, not meeting your preventive service goals resulted in financial penalty. The large portion of the program, in my opinion and the opinion of many others, is the appalling provider reimbursement rate. It's probably about 31%, or 30 cents on the dollar. And so when we talk about provider participation in the program, whether it's GMC or whether it's dental fee-for-service, if you can fill a chair on 80 cents on the dollar, why would you fill it with 30 cents on the dollar? That's just smart business. And those who do participate in the program are doing it because they're sharing in the care, quite honestly. Hospital dentistry cases or cases done under general anesthesia, still a problem in terms of local access, as Kate Barinelli mentioned. The plans conducted their own plan survey of satisfaction. They also conducted a member survey that we actually analyzed for them last year, and about 50% of the families complained about, I'll call it customer services. We called the dentist, can't get in. And admittedly, you know, there's many factors involved in utilization, not just the structural side, meaning the providers, the reimbursement. There's also the patient or consumer side, and that's the personal responsibility part. Personal barriers, transportation, and so forth, but the willingness to act on your understanding of the importance of dental care, and we'll talk about that in a moment. This time, working with Department of Healthcare Services as a partner in wanting to find out what this program was doing was a lot more complex in terms of data requests, in terms of communication. That's not sort of an issue here. That's more of a generic problem. So we always want to know, so what does Sacramento look like relative to other places and other states as far as the kids and their percent of decay or oral disease? And the good news is we don't look any worse. The bad news is about a quarter of the kids that you screen in the preschools and kindergarten screenings are going to have some untreated decay, some of which is urgent. And that's a problem. So as I mentioned, we were able to survey local dentists. We got a really great response rate for dentists. Sorry, but it's very good that close to 40% actually submitted a survey. So 299, 10% of whom participate in the GMC or fee-for-service programs, the remainder don't. And those who stopped taking, who used to take it but stopped, primarily because of the low reimbursement rate. So we said, so if there are certain improvements like reimbursement, like helping patients with case management, like reducing the paperwork, might you be interested in? Close to half said, yeah, if those things change, there's a pretty good likelihood we'd be willing to participate. So that's really positive. Another thing that we've been collecting data on, and so I was happy to have Sacramento in addition to the other counties in which we've gotten this information. It's all consistent. You say to the dentist, how much would the reimbursement rate have to be raised by for you to participate? Because, 5%, 10%, that's not going to bring in providers. But at least 80% of them said, and I'm just combining those two figures, said if you raised it by 50% or more, we'd be likely to participate. 30% said the place to put it is 70 to 80%. That sounds like a chunk, but remember the Denti-Cal budget is it's in the report, I forget, 1.2% or whatever of the $1 billion Medi-Cal program. So really a very negligible amount. And I've already commented on 3/4 of the local dentists who participate in the program are seeing kids by age 1. Emergency department use. Theoretically, you wouldn't need to go to the emergency room for a preventable dental condition if you had a dental home. And we're not talking about trauma, we're just talking about toothache, infection, and so forth. So there's still, even though these are a small portion of why children go to the the ED, nonetheless, there were 1,400 visits in 2014 for a dental condition that theoretically was preventable, and that's too many. Not much difference among the plans in terms of did this plan's kids go more, did this plan's kids go more. They're pretty consistent. What you see in the red bar there in that bar graph, the difference between this 2007 and 8 period and the 2014 period is you've got public payer source paying for about 2/3 to 3/4 of these visits, and that's primarily Medi-Cal. So again, one more evidence of an access problem and an education problem in terms of patients understanding who their dentist is, who their dental home is, how to use that system. 5 years ago, there were not the number of children's dental clinics in Sacramento County that there are now. There are at least 6 of them currently built as a result of funding from First 5 Sacramento. All of the local nonprofit community dental clinics are now contracting with the dental managed care plans, which is super because it means the families have an opportunity, if they wish, to use the clinic as their dental home. And you can see from the little red portion of the bar from each of these contracting plans what portion of their patients are using those clinics. There was a process put into place called the beneficiary oh boy, I'm always forgetting what BDE is. But anyway, a dental exception. It allows, theoretically, families who want to withdraw from managed care and go into fee-for-service, meaning thank you, but I'll find my own Denti-Cal provider on my own, to be able to do so. Well, out of 573 requests that came in as of last July, the department did not transfer any of them. They were basically denied. What happened, though, is the department had to step in and basically handle the access problems for those families with the help of the dental plans, because these are the dental plans members, saying, okay, we're going to help you, this is who your dentist is, let's find you a home, let's help you make the appointment. I'm told that in many cases, part of the access problem is that the patient will say, I would like to come in on Tuesday at 3 o'clock. Well, if the dentist's office doesn't have a slot Tuesday at 3, they have to offer you another slot. And as we all know, we don't always get to say when we want to go to the dentist. And so that's sort of part of the issue, is learning how to sort of relate to your dental office. Anyway, here are some of the categories of those particular requests. Anyway, the top barriers for the families when they responded to the survey, and you'll see that it was reported by between 7 and 12%. Long waits during the dental visit, which nobody appreciates, obviously. Negative interaction with dental staff, again, your customer service sorts of issues. Fear of the dentist, that's a biggie. It either is the parent's fear because of childhood, trauma experience, or the child's own fear. And the absence of tooth pain. In other words, no pain, why go? And we had people actually write in, my child has no pain, I have no pain, whatever, why do we need to go? We even had people say, I take care of my own kids' teeth. I brush them and I floss them so they don't need to go to the dentist. So you see we have a little education issue going on. The good news was that most of them, about 9 out of 10, did know that their kid had dental benefits. That's something new. Not everybody sort of used to be aware of that. 70% took their child on their own. In other words, it wasn't because the school sent them or whatever. So again, evidence of good patient education, and 70% strongly agreed it was not that hard to make a dental appointment for their child. Interestingly, there was a slightly higher percent who said that among the patients who completed the form in Spanish. I would not have expected that. And that almost, close to 100% understood that baby teeth were important. So the findings about utilization, as we talked about, and the top graph just shows it by the age group. Naturally, the youngest children are going to have the smallest proportion of use, but you'll see the red bar on top in the 0 to 20, all children, that's your 39.6% utilization. And utilization measure was annual dental visit, and that's pretty typical. The purple graph horizontally on the bottom shows you where Sacramento GMC falls, and it's the second lowest bar. The bar below it is kind of not fair in a way. Those are the kids that are in Sacramento fee-for-service, but that's kind of a unique population because those kids, for the most part, have disabilities and other things, and they're going to have more access problems anyway. But nonetheless, you see where GMC falls relative to the national Medi-Cal or Medicaid average. We used Fresno as our proxy for fee-for-service because it has characteristics much like Sacramento County in terms of demographics, number of clinics, and so forth. And then across the board, California Medi-Cal average is 52.5%.
Madam Chair?
Yes.
What this bar chart doesn't show us, Ms. Avid, is the highest rate in the state. Do you know what that is off the top of your head?
I think it's Monterey County. It's either Marin or Monterey. You mean which county?
Mm-hmm.
Yeah, it's either Monterey or Marin.
You know roughly what it is? Is it in the 70s?
No. I'll sort of flip to it, and maybe I'll be able to find it quickly. I should know. I feel like I lived with this report often enough. Here it is. Okay. Marin, 67.5. Monterey, 64.4. Bottom, Trinity, 28.7. That's the range.
If I can just follow on that question, though.
Sure.
Because we deal with percentages, and again, that's not unfair, but I think the numbers, though, I mean, I don't know how many children there are in Trinity County or how many in Monterey County, but, you know, being in an urban county in comparison to either, you know, maybe a less populated county, I guess I'd be kind of curious what those numbers, because, again, it's all relative, obviously, to people getting in. But as you stated, 154,000 or some number of that, or 158,000, and if it's 30 or 40% of that versus a pool of 5,000, it's again the percentages don't belie the facts, but I just think that that's important too, as to how the relative numbers. And I don't are those numbers available?
We don't have, I can give you those numbers, I don't have them handy, but again, it's a rate, with all due respect. Yeah. I understand your point. In absolute numbers, Trinity doesn't come close to looking like Sacramento, but in terms of rate, if you say there's 5,000 kids and 4,000 made a dental visit, you're going to have a better rate than Sacramento.
Oh yeah, absolutely.
Yeah,
no, I agree with
that.
you, Barbara. Yeah, I agree with that. I just because that's one of the things that kind of gets lost in the mix here. I mean, if you've improved, from, the teens to now, approaching 40%, that means, in Sacramento County's case, it's, that could be, tens of thousands of kids versus, or at least several thousand, versus, again, using Trinity as comparison or somewhere else.
Sure.
And so I think, again, it goes to the numbers, and I think that's part of the challenge, obviously. If you have more children, you may have more dentists, but to some of the other things you were describing there is again, that's important because those reflect real people, real families, and I think also go into the efforts, as you were saying, is trying to instruct parents and caregivers and so forth about the importance of doing this. That all goes to very personal, versus we use statistics to guide us in programmatic assessments and so forth. So that was why I was asking about the numbers, and so I guess.
Sure.
Yeah, but are there reports that then actually show the real numbers?
Mm-hmm.
There are. Okay.
Mm-hmm. Yeah, by age group in terms of how
by
many
age group,
use.
yeah, okay.
Yeah, for each county, and I'm happy to send that information to you.
Thanks.
Yeah.
Thanks, Roger.
So kind of to Mr. Cerna's point and setting a goal, we asked all of the people we interviewed, so California doesn't seem, or Sacramento doesn't seem to have said, this is where we would be satisfied. If we could reach 60, 70, 80%, whatever, we would feel satisfied, because not everybody's going to go. We understand that. But there has not been a goal set, and I think there needs to be, and that was a recommendation. On average, people suggested 70% would be an appropriate goal. Higher than that, it would be great.
Was there any mention of kind of annual steps, as I suggested?
Not at this point, but I'm sure McDAC will talk about how it could do that incrementally. One of the main reasons I think for what feels like a plateau, we won't know until we see 2015 numbers, and better yet 2016 numbers, is the infusion back into Medi-Cal of the adult population. When those benefits were restored in May of 2014, there was the pent-up demand, and there were tons of adults who had horrible dental decay, who began to basically usurp, it's not the nice word, but take the appointment slots that the kids were taking. This is true across California, and many of the providers, certainly the clinics, were kind of bombarded with this tsunami of need, and it kind of displaced. And the plans I know began to see, at one point they said we're seeing, about 75% adults now to children 25, but now the pendulum has swung back for most people, and we're kind of now at 50-50. So I think that's partly responsible for why the figure didn't change much between 2013 and 14. I won't spend much time on this slide other than to say, it's in the report, and when we looked at all of the performance measures that the department instituted in the contracts of the plans, we were sort of curious which ones were achieved by at least one plan, and that's what the check marks in the middle mean. And then we note if it was all the plans or some of the plans, whatever. Just very quickly, I know we're running out of time, but the lessons from other states that I think California should pay more attention to and isn't, is what they have done in terms of administrative structure to improve the program. They have, many of them have gone to sort of a managed care, hybrid administrative services model, and they're exploring the use of more integrated medical dental models so that we co-locate dental with medical, because there's the way we're going to get, for example, more pregnant women seen for dental care, and so forth. Many examples exist. Importantly, almost all of the states who've increased their utilization have increased their provider rates. You just can't do it one without the other. Our recommendations are many, and so I don't really want to take your time by listing or talking about them when they're in the report, but we do sort of organize them by what we think can be achievable within a year, and then what might take a year or two to achieve. Admittedly, many of these are directed to Department of Healthcare Services, but working in partnership with McDAC, stakeholders, and the dental plans, because, truly it is a team sort of effort if these kinds of things are going to occur. And as was said earlier, and I appreciate the comment, that structurally the state is the one that holds the policies for the most part, and administration in terms of whether we're going to actually make this a model and the pioneer. California is usually our pioneer when it comes to many public health programs, but it's fallen very short in dental.
Through the chair, so I want to be clear, the first recommendation there, is that what I've suggested?
This particular benchmark has to do with, for sure, preventive visits.
But is it when you say adjust benchmarks requiring an increase in performance, measured by what? Measured by utilization rate?
Yes.
Okay, so it is what
yes.
we were talking about earlier.
Right.
And this is short-term, 1 year, what would you think is a reasonable
Oh, I'm sorry, I meant
percentage?
within a year, put this into the contract so that you're adjusting the benchmarks. In other words, we're not going to be satisfied if it's at 40, I can't remember what it is, maybe 44% or whatever for the plans. for which they are not penalized. It doesn't mean that that's our goal. It just says that if you can reach this benchmark, you'll get your full capitation. I think what you were referring to is let's set our goal for utilization, regardless of what the contract term says. But if we say preventive visits, for example, and that was a specific recommendation, these are obviously summarized and abridged, but we talk about preventive services as one particular procedure that needs to have an adjusted benchmark.
I understand. I appreciate the explanation. If there was an interest and a will to consider an annual goal for increase in utilization rate, what would you suggest that be for Sacramento County?
Personally? Well, short of 100%. I do think it has to be incremental, but I would have to hope that we would achieve at least the highest that we have, or match the highest county in the state, which is
so 67%.
67%. Yeah.
Okay, other questions or comments from board members? I just wanted to, this was following on to the issue Ms. Peters brought up earlier. It just seems like 20 years is a long time for a pilot program that appears to have been a failure. How do we go about not being the only county that is in that program that obviously doesn't work well? Do you have an answer?
Well, I do. I have a partial answer, and that is this is a mature program. This is institutionalized. It's not a pilot. It began as a pilot, but basically it's not referred to anymore as a pilot. I think it's sort of c'est la vie. Even 5 years ago, it was like, it's with us. This is the program. Now, 5 years ago, we were specifically asked or charged with coming back saying, we want you to recommend either nuking the program, coming back with some recommendations for a hybrid, or making it voluntary. We recommended that you make it voluntary the way it is run in Los Angeles County. Los Angeles is the other dental managed care county, but families have the option to be in fee-for-service, and I think 80% use fee-for-service.
So we have no way out of this, or?
Oh, I wouldn't say your feet are in a bucket of cement on it, but the BDE process was intended to sort of allow families to opt out and maybe respond to that voluntary, but it is not being operated that way. And so there's a difference of opinion about whether the intent of the legislation was, in fact, as McDAC believes it was, and that is to let people opt out, and what the state says it is, which is to assist families use their dental benefits.
Okay. Mr. Cerna?
Thank you. So I consider this the fish or cut bait question. So at what point, if we're having this conversation next year after that, 5 years from now, and this question of plateau continues to aggravate everyone involved, at what point would you recommend? You're obviously extremely knowledgeable on all the dynamics involved, all the nuances involved in this important subject. At what point would you stand there at the podium and say, board, it is time for you to do something completely different? Your words, nuke it. So, I'm frustrated. I think others are, but I'm kind of curious to understand kind of a blunt response from you and others about how and when, what consideration would we make, how would we measure failure to the point where we have to do something comprehensively very different than what we've done in the past.
Mm-hmm. I guess two comments. One is I'm going to ask if Dr. Jones is still here as chair of the McDAC, he may want to comment.
Actually, one of our speakers signed up to speak.
Right. And if he wants to respond to that. But I guess I would also wonder if the board might say, if you're back here in 3 years and it hasn't reached this particular thing, that's sort of our cutoff point. I mean, you may want to consider that yourselves in terms of putting some sort of deadline on it.
And that's why I made the suggestion I did earlier about reasonable percentage increases that we look at, everyone looks at, McDack, our consultants, everyone, first 5, over the course of, handful of years, and use that as a true metric to understand whether or not this is going to be a consistent plateau, and if so, do we completely go in a different direction?
Mm-hmm. Mm-hmm. Fair question.
Okay. So are we ready to hear from Dr. Jones? Thank you very much.
You're welcome.
David. Then call up Terry Jones.
Good morning. Thank you very much for this opportunity to comment. And I want to thank Barbara for what I think is a very thorough and a balanced report. I wanted to stress just a couple aspects of points that she has made. First of all, I think it's worth noting that GMC dental program has increased access from 20% 5 years ago to 40% today. And so I think, that still is an achievement. It should be recognized, and she does point that out. And particularly the 0 to 3% of utilization increased nearly 250%. So I think that's important. And I think she also stressed some of the things that you have done to help improve that, and that is the 5 dental clinics that you have funded with First 5 to provide that key safety net services that are so desperate and are now contracted by all the dental plans. But I think the negative aspect is that the utilization rate remains lower than even the low bar set by the fee-for-service Denti-Cal rate. And I think that's the point. And the point that you capture is that this is not because of 1 year or incrementally 2 years. This is 21 years of GMC in Sacramento County. This is an entire generation of our children, our families, being raised and being neglected by a dental delivery system that was a pilot program. So 21 years. Those children are now moving into the adult Denti-Cal system. They, like their children, are not given a legitimate option to move out from under GMC. It's still mandatory for them as well. So I think the focus, and again, I'll go back, unfortunately, that the goal of the whole dental delivery system is to provide a dental home, and really it's almost a disservice. It's more like a GMC, this system has provided more of a, tenement housing rather than a real legitimate dental home. And so I think I'm going to step back. My main point is that McDack offers the voice to the people within our community. It is about the local providers. It's about the local patients, beneficiaries, given an opportunity to speak to these larger macro policy discussions that are taking place about fee-for-service, about GMC, about state dental, about a variety of subjects. And that voice, I think, needs to be heard, needs to be valued, and needs to be acted upon. I don't think that has happened in the past to the degree that it needs to. And I think if McDack is given some sort of a authority outside of its bully pulpit, I think that would be great. How that happens, I don't know. McDack represents your interest. McDack represents our citizens' interest, and I think that needs to be done. I think something that you can do, I think that First 5 has done a wonderful job increasing the universal access for 0 to 3. But now the dental system involves adults. It's past what First 5 alone can do. I think some sort of contribution by the larger county budget with regard to administrative services that need to be boosted up. Most of these discussions that we have at McDack are about policy issues, about follow-up, about how certain particular items impact utilization. We have sufficient number of performance benchmarks to match. I think Barbara has alluded to, getting timely access to data from the state just is a nightmare. So how we provide oversight when we're not given timely access to state data, or we're not asking in the proper way, those are kind of things that really are difficult. And I think if we had strong administrative support that continued to pester the state, maybe not pester, but at least follow up on requests.
Pester.
I think that would be great. And again, it's not just about the 0 to 5 that, you know, our first 5 people follow up very well. It's about the adult. It's not about dental disease. Both caries and periodontal disease are a chronic disease management. It's a tremendously important thing that we do. I see I'm running out of time. So I would say, again, do some funding for the administrative support. Secondly, I think you can see that having a report periodically, as Barbara has says, once every 3 years at minimum, great. And I would say the minimal incremental utilization rate that we've always said is that low bar fee-for-service statewide, 52%. We can't even get half of our citizens. In 2013, CDA will not like this, but 2013, fee-for-service was 44%. So they vacillate just as well. But we're not even up that low 44%. I do have to say that, you know, the dental plans, we are in this system. You don't have the authority, I don't think, to change it. It's a statewide program. So giving us some power to discuss that, maybe encouraging, you know, some of the programs that we've asked to support, that's great. But that's our dilemma.
I think we
Thank you.
understand that we don't control that, but we can certainly, if the board was so inclined, pursue a different direction with the state.
Yeah, I'd welcome that, but I do think supporting McDack, providing some administrative, and funding another study would be a great opportunity, so we don't have to ask the plans to do it this next time.
Thank you. Mr. Cerna?
Dr. Johns, before you leave, so I'll ask you the same question. And I want to make clear, I want to preface everything that I'm going to say that I have said and be very clear about the fact that I thoroughly appreciate all the great work that the McDack has and continues to do. I think it was 3 years ago, I joined you testifying in front of a committee at the Capitol on the subject. So I'm equally frustrated. So I'm going to ask you the same question. I mean, at what point does this board begin to turn the ship, or at least attempt to, in terms of going in a very different direction? You spent a lot of time in your testimony explaining, and I appreciate this, the fact that we can't even get anywhere near the bottom of where we ought to be here. And you know, I for one don't want to have this conversation next year. So I'm personally getting very anxious about pursuing something completely different, admitting that it's not working. So I'd like your thoughts on that.
That's a tough question. I think Barbara has made a suggestion that if it's not working, give the option, a legitimate option for the members, for the beneficiaries to opt out. So that would be a first step. Make that BDE process live up and not just pay lip service to, you know, a kind of a phony option. So that would be one.
So expand option and the option to go fee for service.
And they can walk. If they're not satisfied, let them walk. Let them go to fee for service. I think the risk that you place here is we don't have the infrastructure for a wholesale abandonment of GMC. And so I'm looking back at CDA because, I mean, I get the idea of this, but I think this is 21 years that we've been operating in GMC. We have providers who cannot afford, who are unable to operate in a system that pays them a third of their usual and customary fees. That's going to take a little bit of time. So just abandoning this one and replacing with another, I think we're experimenting again with our beneficiaries. I mean, the point of it is Liberty and some of the programs actually have attempted to do a hybrid system, and I think, you know, Mr. Cavelli will speak with that, where fee-for-service is being paid to some of their provider dentist. And I think that's an option that shows some promise. I mean, the problem I have is I don't know the answer, but I worry about just abandoning it wholesale.
Thank you.
Thank you. Mr. Antonio.
Yeah, before Dr. Jones leaves, just again, picking up on something you said, Terry, that I think it's resonated with me, and it was maybe even embodied in comments by the chair a moment ago, that, you know, if, you know, further empowering, again, you know, pestering, that's you know, that's not, I want our MCDAC and certainly this county to be taken seriously and to be a force to be reckoned with, and recognizing that, you know, if we're, you know, in this statewide program and we're 21 years in, bottom line is, though, the advocacy on behalf of the children and certainly the adults that live in this county that you know, need to have, you know, access and the ability to hopefully you know, seek out and to find easily you know, services that help them with certainly their dental needs in this case. That to me is an imperative. And I guess I don't want to be sitting here 3 years from now and you know, having the same conversation. You know, I acknowledge the progress and credit certainly our committee and our dental community, and certainly First Five, and certainly Barbara for her work on all this. But you know, it seems to me that listening this morning and reading the report and looking at the next steps to implementation, to your point, I hear you, you know, saying some additional support for, you know, the advisory committee and for their role, and certainly for, you know, maybe whether it's us empowering that and budgeting. But when I see the 2 staff reports that just give us a receive and file, that doesn't say anything about what you've just spoken to. And so I guess I'm curious, has that additional administrative support, the frustration with the state, which is evidenced throughout this report relative to getting timely data that allows us to, you know, more real time, rather than, you know, looking back 3 years and saying, well, you know, that's what it was and we could have done better, or we're doing better. Those things, if there's a plan that this board needs to consider that has either funding, because this, again, our 2 staff reports say no general fund support and so forth. Well, maybe it's time that we even consider that aspect of it, to support the efforts and to provide whatever advocacy and or interaction or intervention that, you know, will, you know, again, make it clear that we at this level are, you know, as a community, are not satisfied. In fact, maybe it's an expression of dissatisfaction about not necessarily the progress being made, but about the general direction this has taken over a 21-year period. If someone was, you know, an infant 21 years ago, as you said, they're now legally an adult in the state of California. That's a long time. That's a generation, and you said it a moment ago. And so I guess what I need to know as a member of this board, and again, you've been a strong advocate, appreciate your work on this, yeah, and I guess I would turn to our staff too. You know, besides giving me a receive and file, and then when I see implementation on the, you know, page 96 and 97 that talks about things the committee could do, you said they need to have additional support. I didn't see that embedded in the report here. If they need to have that, and this board wants to put additional emphasis on this issue, then I think we need to know that. And so I guess my point is, and Terry, and you can weigh in here, is that whether it's a budgetary consideration, a staffing consideration, an advocacy consideration, this board either collectively or individually, you know, needs to take to keep this issue in the forefront, and to not be looking at this 3 years from now saying, well, you know, we could have done more, we've done better, we're making progress. You know, we need to get off of dead center at some point. And the state obviously controls a lot of this, but we still have a bit of ability to influence our destiny as it relates to the people and the families and children in this community. And I guess my view is that we need to have more information to, you know, empower our committee, if that's what it takes, to provide them necessary support, and to have this board engaged if necessary. And so we have a health subcommittee of this board. To me, this is an important issue. You know, it ranks up there, at least in my view, on some of the higher level of priority health issues in this community. And again, we have good, strong partners, and we got providers that help us, and you know, there's been some progress. So, Terry, I would ask you, what do you think it takes, you know, relative to the implementation? It's in the report. You mentioned it. Do you have other recommendations for this board this morning that you and your colleagues would tell us? Here's what you think this board needs to do to help engage as a county.
Thank you. I think you're very appropriate in your discussion. I think I'll go back. We meet monthly. We meet for about an hour and a half. It used to be that DHCS was there at every single meeting. Now their workload doesn't permit them to join us. And so they meet only as the letter of the law demands, and that's quarterly. We think that's a bully pulpit issue that, we need to get past that. But at every one of those meetings, our staff, the staff of First Five, is diligently writing down all the comments of our local providers, all the local beneficiaries. They don't have the time to engage as to the degree that is necessary to really follow up with questions to DHCS, to Department of Managed Healthcare Service, to the dental plans. I think we need to have a full-time staff person that can provide that, at minimum, the note-taking and the follow-up with all the questions that arose during that time period, so that it frees up some of the staff to really engage fully into this conversation, because they really are the most knowledgeable people on this MCDAC committee, and most of us, like myself, are volunteers. So we're going in, relying on our staff to provide a lot of background information. We follow up. I follow up with CDA. I follow up with the dental plans, but it's the staff that does all this work, and it's behind the scene. And again, I think First Five has done a wonderful job, but this is not about children. This is now about adults. It's not just First Five's purview. I think after a generation, I think minimum, a staff person full-time that provides that kind of note-taking once a month and follow-up treatment with clarifying this would be a minimum. I don't know what that entails. So that's one thing. Then I think a budget item that says getting data and getting a legitimate, an honest appraisal of how we are in 1 year, good luck. We need somebody who actually who worked for the Department of Healthcare Service, someone like Barbara Avid, someone on the outside that will actually follow up and do that kind of research that will tell us in an independent way, where are we? Because that data is available somewhere in the bureaucracy of the Department of Healthcare Service, and I think they genuinely want to make it work. But I think that transparency issue and that open, easy access for our beneficiary, for our local providers, just ain't there, and that needs to change.
Can I just ask you, Terry, then, and would you be your sense that if you had those additional dedicated resources and we were able to get that data, that we would be able to then either make adjustments in our approach, or again, Pester is being too nice about this, very frankly, to do what needs to be done to call it to the attention of those that can maybe make some changes. And again, maybe it's not the legislature government, maybe it's somebody in the Department of Health Services of the state, or in some other aspect of that department. Do you think that would then give us the ability to be more nimble, I guess, and to do it more real time, but actually to make some changes? Or are we just going to send them data and so, okay, well, here's the report, and it came to us sooner than later, but do they act on it?
It's beyond my understanding whether they will or not, but actually it shifts the conversation from this discussion that happens at DHCS, at CDA, at all these statewide organizations, which are legitimate, back to your local area. So it puts your imprimatur behind our actions, and I think that's up to us. It puts you back in the driver's seats to take care of our families.
Okay, that's valuable. And I guess I just would turn to Nav and to Paul and to others here that, at least in my view, with some sort of report back to this board that if there are some steps could be taken, again, it's not just to send money at it or put money to it. It's to have a coordinated effort that's going to keep whatever pressure we can apply. That is certainly recognize the effort and may give us the chance to be better at what we do and to serve more people and to have the focus on Sacramento County and this geographic managed care program here. I just think we need to do it. Otherwise, the months come and go, the years come and go, and we do what we can with what we have. But I think this, reflecting on it a little bit here this morning, it needs in not only the focus and the attention, but I think it needs constant pressure applied to it. And if we can do some things here locally that help us, bring to bear, some of the resources the state has, and get somebody else's attention at that level, then we're all the better for it, I believe. And so,
may I add that this is not just an oral health issue. Yeah. This goes to the heart of overall health. Somehow separating oral health from the rest of the body is what has allowed this same kind of lack of accountability, the same kind of acceptance of this low rate of utilization to continue. Our African American and Hispanic pregnant moms are suffering all kinds of health disparities. One of them, we know quite well, is having access to dental health as being one of the factors that can help that. These are crossing all kinds of health trends. So it is not just oral health, it is overall health of the body. So I think it plays well if you can support us.
Mr. Cerny.
Thank you. I was going to say this to the end, but since Supervisor Natoli made reference to it, I do think one of the things we can do in fairly short order is to re-energize this board's effort through our standing safety net committee comprised of the chair and myself, and do what we can to directly flank the efforts of the MCDAC. We are known at times to jointly sign, all five of us, advocacy letters on subjects that we all feel very strongly about, and I suspect this might be one of those instances. But I do think it is the right time for our standing committee to take this matter up and have some very in-depth conversations with all of our relevant agencies and staff about what we as a board need to consider doing to complement all the great work by the MCDAC. I know we have other speakers, so I'm curious to hear their comments. Thanks.
Thank you, Dr. Jones. And the next speaker is John Carvelli.
Good morning, Chair and Supervisors.
Good morning.
John Carvelli, Liberty Dental Plan. I think you heard Dr. Jones mention us. I appreciate that. We are an active member on the MCDAC. We have been privileged to be working with Kathy Varnell, I guess she's gone now, with the County Sealant Program for years. We are a 10-year dental plan here in Sacramento. BC 5 years ago, and then AD. Here we are again today. And Supervisor Cerna, I don't know if you remember me, but I came to see you to tell you about our concerns about just where we are here today. I guess that was 6 years ago when you were chair. And we went to see Supervisor Dickinson at that time as well to talk about this. Good folks, we are really disappointed that we can't stand here and tell you that we've achieved these, at least national averages for utilization. We can say that, and I just want to leave you with this, we are recommitted and would like to reaffirm our, efforts and contributions to work with you to make this better, to continue to make this better. We feel good about the improvements. That's something to point out, particularly the 0 to 3 kids. That is a big deal. We do this nationally. We do it in Illinois, Florida. That's something that we might be of assistance to you to provide that kind of experience and data if you are so inclined. We'd committed to do that. Committed to work even closer with Dr. Jones and the MCDAC to provide more dentist involvement in the program. Every week when we look at these numbers and get frustrated, I can tell you what we did last year, something new. Dr. Jones mentioned it. We decided to take all the risk away from the dentists here in Sacramento. We pay fee-for-service. Liberty pays fee-for-service. We pay a specialist 140% of the Denti-Cal schedule. We don't have a year's worth of data on that, but we're looking forward and hoping that that will increase utilization. We have 2 initiatives that we're going to roll out this year. One's a school-based initiative working with the other dental plans. We hope those initiatives will be different this time. Another one working with pediatricians to get that assessment, get credit for it in utilization. That's been taking a lot of effort. So we're continuing to try to figure out ways to improve this. We are absolutely disappointed and sense your frustration. And I would leave you with this. Any help that you can do or give or say about data transparency would be critical. It's very frustrating for us as well to be compared to these statewide fee-for-service numbers when we're a different program. We just are. And to compare Sacramento County to, I don't have to tell you, to Marin County, it may not be a great idea. And to make big decisions about changing the program without thinking about the budget dollars that probably should be a part of that discussion, something I would also urge you guys to, you know this. But again, we are here to help. We have been here. We're going to stay here. We're here as long as you'll have us. And we hope that we can add something to the improvement of this program.
Thank you.
Thanks, John.
Thank you.
And our final speaker is Kathy Levering.
Hi, good morning. I'm the Executive Director of the Sacramento District Dental Society. We comprise 5 counties, of which 65% of our members are Sacramento County. We have 80% of the market share of dentists, which is unheard of nationally as well as within the state. We have 1,400 practicing dentists. We're the ones that did that survey that got a 40% response rate. I am so glad, Mr. Natoli, well, all of you, to hear finally the fire and passion. I have been the executive director for 16 years. It started coming to you in 2002 and the C Street Clinic. And it's not a place for kids. What are we going to do? Since then, the C Street Clinic has closed. We started a children's dental task force. I'm sorry, my blood pressure is like going crazy because I'm so glad we're talking about this. We started a children's dental task force where I don't even think any of you were in these seats. It was Roger Dickinson and it was...
Don was here.
Don was here.
You were here. I'm 62 now, and I have vowed that I am going to see this through. So the Children's Dental Task Force started before there was ever any McDac, and we took it as far as the state. We identified the problem of the pilot program. We identified the problem that there weren't enough dentists to accept 25 to 30% reimbursement rate. We had all that information. We coerced dentists to do their share. The barriers we found were too hard to sign up, reimbursement rate was terrible, and it took 6 months to get reimbursed, okay? So with that, the Children's Dental Task Force had something to do with, because of the state, because we kind of were persistent and pesty and pestering, we changed the contracts. We asked the state, why aren't you withholding? There's a percentage here that says, or in the contract language, it said, if you fall below a 37% utilization rate, we're going to withhold your payments. We asked the state in a meeting at the Children's Dental Task Force, have you ever withheld? No. Why not? We're understaffed. So we luckily were invited to be part of the new RFP process. With that, 2 programs were dropped, two providers were dropped, Western and Community, and we fixed that. Are they still withholding? Yes, they are to a point, but it's not perfect. Fast forward to our legislative efforts, which we sat right with you and testified. Yes, McDac was born out of that. We came to this body originally to get rid of GMC because it was a pilot program and wasn't working. We identified the problem that the reimbursement rate for fee-for-service needed to come up too. And that's where I really think, on behalf of our dentists, we could get more to participate if we could raise that. And that's luckily, I mean, we'll march on the Capitol if we need to, but that's what our dentists want. If it was easier to sign up, that would be a big perk. It's still, you can't even sign up to be a provider online. And they've been working on that for 3.5 years. Any help that you could do, oh, I'm over, so sorry. we've done Band-Aids. We've done first tooth, first birthday. I had them in your office. You took it to your pediatrician. We're making progress. And I want to end with the positives. We do a program which we have done since 1991 called Smiles for Kids. We're out in the schools. We work with the school nurses, and our dentists screen 20 to 30,000 kids a year. This year we did 22,000 kids, and instead of treating 1,000 for free next Saturday, we're only treating 450. And that's telling us that no longer are that many kids, there's still a lot, but not as many, who fall through the cracks, have no Denti-Cal, have no insurance, and can't get help, and they have urgent care needs. So we're only going to see 450 next week. That's a good thing. More kids are getting insurance, more kids are getting Denti-Cal. Now we need to fix how they get Denti-Cal. So thank you all. We're here for you. I'm not retiring until this is done. And I promised my board and all our dentists that, okay? So let's do it fast, okay?
Thank you. And does any board member have anything to add at this point, Mr. Cerna?
Just again, Madam Chair, I would suggest you and I convene with staff as soon as we can, and certainly give staff a little lead time to maybe think through how they would have us convene with the right folks in the room to work through our committee to figure out how this board can best spend its time and energy to to raise the volume if necessary, if that's what it is, to get, as John mentioned, more transparent data. But like Supervisor Tully said, it's great we're getting a receive and file, but there has to be some action to implement here, some real change. And I think we just need to do that very thoughtfully, and we have a structure to do that. So I would respectfully suggest that we engage that process.
Okay.
Yep.
Mr. Anatoli?
Yeah, no, I would support that and appreciate my colleagues' willingness, certainly on this issue and others, to come together. And I guess I would maybe, as a part of that, ask that we maybe get this back to us in a couple of months, if maybe pre-budget. I remember times actually going back 20 plus years ago when they were talking about geographic managed care, and we were going to be the pilot, and having state folks here and talking about how we got chosen, or basically got told that's what we were going to do, and a lot of conversation. Well, coming to today and where we go from there, maybe it's time to invite them back. And again, it's not so we can bristle at somebody across the dais here, but it's actually if data transparency and timely release of information so that we can where we are empowered to weigh in and to maybe make some adjustments, and into working with Kathy and the dental society and so forth. It seems to me that as I said, months go by, years go by, and not for lack of good work, but I'd like to see us have an opportunity to continue focusing at this board. So whatever the chair and certainly Mr. Cerna would find as appropriate timing, but I think if there are any budget considerations that relates to staffing or other support, certainly advocacy, you can come back sooner than that. But I would like to have a report back that talks to the implementation, but also any other strategies that we might employ, including, as you said, a letter, if it needs to be, from 5 members of this board, if we're all agreeable to, again, but that's kind of a one-time deal, and so I support that approach. So thanks.
Okay. Well, item 54 and 55 were informational items, so that concludes items 54 and 55, and we're now ready for the next item.
Item number 56 is the authorization to add $1,723,176 in funding from Immigration and Customs Enforcement to the Sheriff's Department's budget, approve a salary resolution amendment changing 22 positions in the Sheriff's Department from unfunded to funded, and approve an appropriation adjustment request.
Okay, I believe our presenter is Sheriff Jones. Good morning.
Good morning, Madam Chair. Members.
At least it is still morning.
Yes. Good morning, members of the board. I appreciate the opportunity to present on this particular issue. I first have to apologize because most certainly at some point during this presentation I'm going to hand it off to Under Sheriff Lewis to continue and field your questions. I have a prior commitment that, unfortunately I couldn't get out of that was scheduled before this that I'm running into conflict with. But just to give a brief history of where we are is, as you'll recall, in June at preliminary budget discussions, we came to you with our concept that we had been working on for some time about moving the department towards intelligence-led policing. We asked for a couple of different things. Well, actually, we asked for 46 positions for the first stage of that implementation. We tried to mitigate the cost or the impact of those 46 positions a couple of ways. Number one is we only said that we could fill a certain number of positions. In other words, we said that likely there would be about 22 positions that we would not be able to fill right away. So we asked authorization for the position and the commitment to fund them when we could fill them, and we estimated that would occur right around mid-year. Here we are at mid-year, and it turned out to be our predictions were much more accurate than we can normally make them for some reason, and we are left with 22 positions, 21 deputies and 1 lieutenant position that we can are in the position of to fill immediately. And so we are here today, and the item is on the agenda to be able to come back and ask for the funding that was committed for those positions back in June and beyond of last budget cycle.
And can you explain further how that will address your intelligence-led policing effort? Will that fully staff it at this point?
Sure. So I mentioned there was a couple of things we did to try and mitigate the impact of asking for those 46 positions. The second thing that we did, and we presented the information to the board at that time, was that this was really the core of what was needed to actually make that move towards intelligence-led policing. It wasn't our only needs, but it was the needs that we needed right now. We were able to put off our other needs, and we even mentioned a 2 or 3 phase plan by years that we would be coming. It wouldn't represent our only needs, but it certainly would represent the needs to go to the first step. There's a number of steps involved in this intelligence-led policing transition. It is using kind of real-time data to, rather than anecdotal information about our workloads and work needs throughout the county, we can have accurate, up-to-date, up-to-the-minute information about where our workload is and where we're needed. So we have done a couple of things in anticipation with the commitment that the board gave this past budget cycle. We've made a couple of large moves in reliance on that. We've redistricted the entire county of Sacramento, and within each of those districts we've created zones. Those zones are going to create approximate identical workloads. They may be staffed with 1 deputy or 3 deputies, but each zone will have an approximately identical workload. The idea of that is, instead of using a lot of their time to spend going from call to call throughout the district, as we made the little graphic with the little police car moving around during the presentation, if you recall, the officers will be confined to more finite geographic areas. So they, in effect, will have ownership of the geographic area, and the communities themselves, or those geographic areas, will have ownerships of the deputies that are there. The other thing that we did is, historically, we've had deputies that go across scatter across all days off and different supervisors, which lacks a significant amount of accountability, both upward and downward. So we went to a team policing model. So now officers are on the same team of officers with the same supervisor every single one of their work days. Increasing the level of supervision and management also comes with it in the intelligence-led policing model expectations, not only for the officers to take care of those both the policing needs and the POP type needs in those areas, but sergeants and lieutenants to take on some of the more intermediary and long-term issues and problems that occur. Those things have already been done. We've already redistricted, we've already bid, all the deputies are in their policing on their teams with their set supervisors in their geographic areas. Now, we haven't really gone to the particular zones, they're just more in the area, but they all know what zone that they're going to be going to when we pull the trigger. So the final installment of the 21 officers, to make a short story long, will be to allow us to make that final transitional step into those zoned responsibilities for those officers to be able to have the ownership of those areas. The other thing the intelligence-led policing did, which is important, is historically the officers have had about 15% free time, and we did some staffing studies. The goal of intelligence-led policing, and frankly the requirement of it, is that they get to a 45% free time staffing model. And we do that with increased efficiencies, because now we know, rather than anecdotally, we know what crimes are occurring and where and what the workload is. But we also created that class, if you recall, of community service officers that go out and take reports from calls. And we've done studies, and the reality is bearing out those studies to suggest that that will also increase the free time for the officers to tackle those non-911 response type issues in their geographic area.
Okay, questions by board members? Mr. Cerna?
Thank you. And thank you, Sheriff, for let me turn on my mic. Thank you, Sheriff, for being here this morning. You know, I think I'm certainly prepared to support staff's recommendation. As I recall correctly, back in June and September of last year, this board, I think, was generally impressed with the direction the sheriff wants to take with this kind of paradigm shift for service delivery. But I do want to get some clarification from our county executive that we are going to, as we continue to help the Sheriff's Department implement this new paradigm, I think the general message was back last year that we couldn't do it all at once. We couldn't do it in one year with one budget decision, that it's a fairly sizable budget request that was presented to us, and that we would consider that we would help implement this over the course of maybe 3 years. So my question to you, Mr. Gill, is will we be considering kind of fresh, without too much consideration for what we're being asked to do today, this coming June, when we get into the budget, will we be asked to consider fresh what the next step would be, the second year, if you will, of helping the sheriff implement his vision?
That is correct. What we plan on doing in June is to present to you the year 2 of the 3-year plan.
Okay.
Year 1, with the action, if the board does approve today, takes care of year 1. Year 2 will be discussion in June.
Okay, very good. Thank you.
And I can respond briefly to that. Really, this is going to get us most of the way there. Really the only residual pieces for the intelligence-led policing that will enhance the ability is we've done a staffing study, as you may know, to get the class of intelligence analyst as opposed to the kind of circuitous route they now have to take to become an intelligence analyst. So there will be a request for augmentation of that intelligence analyst as the core for our intelligence-led policing model. But really the phase 2 and beyond, we're contemplating beyond intelligence-led policing and are really more or less taking care of some of the more mundane needs in the department that we've put off since, like many departments, since our layoffs in 2009. So those will look a little bit more boring, but they'll certainly look a lot more modest than they did last year as well.
Great, thank you.
Okay, Ms. Peters and then Mr. Natoli.
Yeah, thank you. I just want to say the sheriff's spoken at a couple of my community meetings recently to people who live in my district and about this program, and universally everyone has applauded it. I've had many comments after you've left of it's about time, you know, it's great. I think most people think, because they watch television, that you've been doing this for 15 years. And so it's a little bit of a surprise that we're just getting to all this magic intelligence stuff, but they've been universally appreciative of the efforts the department's making, and they feel good about this new program. So thank you.
Hey, Mr. Natoli.
Yeah. Scott, Sheriff Jones, I just wanted to make sure that folks may be watching, when they hear free time, that you can explain that means
That's
actually,
a good point. You might want to
elaborate what that means to the points Ms. Peters made, that that you're going to be able to do more in the community as it relates to policing. So
the intelligence-led policing really is to oversimplify it, there's 2 broad components, and one is simply a return to community-oriented policing, which folks are very familiar with, and that is getting out, just talking with the business owners, getting to know the neighbors. If you've gone to a community meeting, it's always very impressive when someone raises a hand and you have the POP officers there and they say, well, there's this house on Elm Drive, and they know exactly who the house is and who belongs there. So what we're looking for is that same level of expertise and intimacy with the particular geographic areas that the officers are assigned to. So that really, I guess to use an old-fashioned term, that community-oriented policing aspect of it. Now that requires the officers not to be burdened with responding from call to call to call to call. So when I talk about free time, it really means the time that they can utilize to build those relationships, to get to know the businesses, get to know the residences. And the other aspect of it, which is really relatively new based on the technological advances in general, in our department in particular, for that real-time data. We're going to have real-time data. We're going to have a desktop tool that every commander, all of us, including myself, can utilize to be able to recognize trends that might have otherwise gone unnoticed, and be able to develop and implement plans that eradicate or mitigate them almost immediately, where otherwise we would not have been able to even see that we had them unless we were lucky or someone was paying attention. So the free time, I mean, if you think about...
Come up with a different expression.
Really.
Everybody knows what pop officers are.
Patrol time? Or
let's
Community
see.
time.
Community time. Happy time.
Yeah, well, it equates to prevention in early intervention, sort of
Correct.
having to respond to a call for service. I mean, again, that's
and
the
we can't
model.
do that if we're otherwise committed, and that's been the issue. And so this will allow us to, in effect, I mean, the idea is to make every officer a pop officer for their own confined geographic areas.
And reduce all the driving time, too.
Absolutely, which
limiting the geographic
increases the
area.
efficiency, which helps us get from that 15% to 45%.
Okay. Any other questions or comments? I have no one signed up to speak, so a motion would be in order.
I'll move the item.
Second.
A motion and a second. Could we please have a roll call vote?
Oh, that's right. You can't vote.
I have no screen.
No screen. Okay.
Supervisors Kennedy? Natoli?
Aye.
Peters?
Aye.
Cerna?
Aye.
And McGlashan?
Aye.
Unanimous vote.
There you have
Motion
it.
passes.
Thank you very
Old
much.
school still works.
Thanks very
Thank
much.
you.
Thanks.
Okay, the next item.
Item 57 is a process for conducting a performance evaluation of the Sacramento Housing and Redevelopment Agency Executive Director.
Mr. Gill, are you taking
Madam
this?
Chair and board, members of the board, the item in front of you, we're seeking some direction from the board. There's a request to conduct a performance evaluation of SHRA Director. City of Sacramento, to the Mayor's office, has assigned 2 members from their City Council to conduct the review. The question for you that we want to get some clarity on is you have 2 options. One is that from your own ranks, you can have 2 board members join the 2 council members and do the evaluation of the executive director, or the Board of Supervisors can direct the county executive to engage with each office, conduct the evaluation with the SHRA director. So those are 2 options we came up with, and we need some guidance from you.
Okay, what is the pleasure of the board? I would just note that since the City of Sacramento has already designated 2 members, that participating in a 2-by-2 might make the whole effort more structured and in alignment. But I'm waiting to hear from other board members. Mr. Kennedy?
Thank you, Madam Chair. I actually, regardless of the structure and alignment with the council, I actually will weigh in on the second option for a couple of reasons. One is, as it says there, it says the county executive or designee to engage with the offices of the members of the Board of Supervisors. So I think it provides us even more opportunity as a body to have input into the process from all 5 offices, all 5 districts, rather than just have 2 people there representing. And also, just to be frank, I think that it removes some of this is, SHRA, and whenever there's money involved, which there always is with SHRA, it quickly becomes very political, and particularly with different jurisdictions. And I think it kind of removes it from the political process, particularly the highly charged political process, and all due respect to our friends and colleagues over at City Hall that goes on over there. I think that it's a cleaner, more representative way of moving forward with the evaluation if we were to adopt number 2 on the recommendations.
Okay, other comments? Mr. Natoli?
Yeah, thank you, Madam Chair. I appreciate certainly Supervisor Kennedy's comments on the preferred choice. I guess I would lean more towards number 1, and I do think there's a way certainly to garner input from other board members. Again, I don't think we're prohibited from certainly having, whether it's county executive and or other staff that could assist a committee of this board in that evaluation. I think some of this goes to not only performance evaluation, obviously goals and any accomplishments that are outlined. And again, this hasn't been done on a regular basis. And it also goes to issues related to compensation and, maybe organizational structure. There could be any number of things. And so I think that when it comes to, kind of the personnel matter of it, that not that we haven't delegated this for some agencies. I think SET is a good example where the executive director, in that case, the county executive and the city manager are the ones who do the evaluation, and maybe likewise with the library authority, although that may have changed over time. And so I guess unless there's strong reasons why not, I would, and I think the city council, to the point that Patrick made, certainly has weighed in already, and the mayor has appointed a task force. I would be more prone to go with the first, and that would have a subcommittee of this board. And we can choose amongst ourselves, and if we have concerns and/or things that we want to add, funnel that through the executive so we don't get into a Brown Act situation, so that the committee members will be apprised of those issues with any conferencing with city council members on the evaluation.
Well, seeking some consensus here, Mr. Kennedy, if you were to be appointed to be one of those two members of a 2x2, would that address your concerns?
Well, you're on your toes, David.
Well, certainly if it goes that way. But I still stand by what I said before. I think it's a cleaner process.
Well, then we'll entertain a motion and see where this goes.
Madam Chair?
Yes, Mr. Cerna.
Is the request for speaking, is it not working?
Oh, there is a speaking.
Okay.
I do have that screen. I'm sorry.
Okay.
Then
I just had a question for our county executive relative to the explanation or the what Supervisor Kennedy has said so far about option 2. Do we know at the city whether or not their 2 city council people appointed by the mayor for this purpose would somehow be soliciting input from the other council members, so that if we went with option 2, it would be kind of apples to apples, although it would come through their 2 city council appointees?
I am not aware of it, but I can make an inquiry and find out what process they're going to follow.
Yeah, I guess my concern relative to what Supervisor Kennedy has indicated as his preferences, as the chair mentioned, that the city's already acted with 2 council members, and so I'd be a little concerned that it'd be somewhat awkward if we had 2 elected members of this group compared to an executive whose charge would be to solicit input from all 5 of us, and if that wasn't being somehow conducted in a similar fashion at the city, I wouldn't consider that to be the best structure, and so that's why I'm a little concerned about going with option 2.
Well, what if we voted in a way of preference number 1, preference, first preference, second preference, and then let the county executive, if we were going to choose number 2 as our first preference, give him a time to talk to the city manager and the mayor and see if and what they think about that.
So go with 1 and with direction to?
I was saying going with 2 with direction, and then if it doesn't work out with the Sacramento City Council, then we wouldn't have to bring it back to this board. We'd then go to number 1, where we would come back.
I'd still have to make the appointment, though, right? We'd have to make a decision about who's going to serve, so it wouldn't be just handled administratively. We'd have to agendize.
Does the designation of 2 members have to be at the boards in an open board session?
It doesn't say that. That's not.
No.
The advice I got from John Weisenhunt is that designation has to come to the board, but you could designate today, if you so choose. Have me talk to the council members. If that does not work, if you pick 2, then I have that option too.
Okay. While we're ruminating over this, we do have one person signed up to speak, Samuel Jackson. Thank you for your patience.
Barely. Good morning, board members, Madam Chair. I'm going to give you a little information on me, because if that 3 minutes run out when the clerk punches the button up there, then she's punching it up right now, then you can ask me some questions. I've been involved in the city county government since 1977. Started out as a prosecutor, came over to the city attorney's office, go way back with Donnie, Councilmember Natoli, who had me running around about the countryside around 79 for Toby. I became city attorney in I spent a lot of time in the city attorney's office, became city attorney in 1994, a couple of months before Supervisor Natoli took seat here in 1994.
Sorry, we're having another distraction.
So I'm giving you this so you know that I know some history. So I served 12 years as a city attorney here. I was on the initial drafting team of the JPA for SHRA. I and Lee Savage from the city attorney's office. I was Lee Elam, and I believe the other person was Richard Yata from the county council's office.
You're going back a ways.
I'm going back. So I'm telling you this so when that clock runs out, you'll know that I have some background information. There has been a process in place, and with all due respect to the county council, when you have some old bones, you have some institutional memory that goes with that knows things that the newer people do not know. There's a process that's been in place for some time. Goes back. It applies both to SHRA and SETA. And with all due respect to your county exec, those persons do not work for the county exec. We made it very clear when we drafted that JPA that they work for the joint, you and the city. And it would be sort of uncomfortable, should be, and unfair to have that person put in a position. We kept those positions sort of equal to all the 4 charter officers and to your appointees over on this side, so they would not feel intimidated by us, so they would not have to ingratiate themselves to us, so they could do their work freely, independently, and respond to the elected officials. So when Ann was serving as your executive director of this agency, and I don't know if Kathy Cossack is still serving over the SETA or not,
yes.
But there was a process in place where every time, I was sort of dismayed, and let me go back just a little bit. I'm a part of a group of lawyers, both active, retired, semi-retired, and I'm semi-retired, and retired administrative law judges and Superior Court judges, and we sort of just monitor agendas and what's going on. Your executive director did not ask me to show up here. I was just last week before another public body in this county, south of here, addressing issues relating to the use of parks and the fairness there. So we monitor these sort of things and show up when we think we can be of some benefit to you. So when the process was set up, that every time the charter officers came up, it was not in sync with the county exec's officials, but when the charter officers came up for evaluation, the process swept along SHRA and SETA's directors. And staff, the process was staff would get information, and it was in particular through the Director of Public Relations, I believe, that was dedicated to do that, get the legwork, comparable data. That comparable data was reviewed, made sure that it was apples to apples positions throughout the state, and we used most often, from the city side, we used most often the 6 largest cities. We got that data. It was submitted through the process. You as elected officials conducted your review of that information, and you did performance, because you're the ones who make the decision as to what that person does in terms of job, what their expectations are, how well they're performing, and then you made the salary adjustments. So that has been the process here, and every time that I came up for an evaluation as the city attorney of the city, I know that the executive director was of the SHRA was coming up as well. I was a little bit, I know you guys are busy and things that don't hit on the radar screen just don't show up. And you got more than enough things to fill your days, your months, and your years. And I was dismayed that this has gone 9 years without it being looked at. And I know your executive director didn't have a chance to work with her as city attorney, but I know that she's a member of this community, dedicated to doing her job, and she's not like me. I would squeak. So I guess that somehow this got lost in the shuffle. So I urge you to, one, go forward with the evaluation and other issues that you might want to look at, including salary adjustment. And I urge you to follow the JPA, which says in it, you are the ones. And it says in it that that this person works independent of the city county, unless there's been some changes since 1982. I know it's been amended a couple of times, but that basic language is still in that, should be still in that JPA. So I urge you to take a look at that. Ask your county council if you want to take a look at that to see what it says. But I urge you to go ahead with the expediency that you deem appropriate to work with the city elected officials and conduct the evaluation and other issues that you think should go along with that. Thank you very much, and I'm sorry for going over, and I'll answer any questions that you might have.
Thank you.
Yeah, I would just point out to Mr. Jackson, it's a completely different organization now than it was.
I know.
No redevelopment agency anymore.
I know. I stood and watched those things unfold.
Mr. Natoli?
Yeah, if I could.
If you have a question for Mr. Jackson?
Well, yeah, it's related to something you pointed out. I guess I would ask this of NAV while Mr. Jackson's still there, because it might be able to shed some light on that. In our staff report, it talked about the JPA, and it was originally executed in 1982 and amended in 1990. We didn't get an attached copy of the JPA to Mr. Jackson's point. If it specifies in there and didn't provide for any other alternative, then the question certainly can be before us as to what we might think about it. But if the JPA was clear, to Mr. Jackson's point, then I guess I'm a little bit baffled as to what the question is now, how we want to conduct that. And if we haven't done it for 9 years or 10 years or 15 years, whenever it's been, then that certainly falls on us and those that would advise us of the timeliness of doing that, and it's something we're going to have to bookmark here. But if the JPA calls it out, it seems to me, I don't know if that's a question unless we want to change the JPA.
I was going to suggest, since we've waited this long, and if we still have questions and need more information, that we continue the item for 2 weeks, and maybe our county council could get us that relevant language, and that might help inform our decision. Mr. Kennedy?
Well, let me just say that since I appear to be somewhat of the fly in the ointment, I'm comfortable enough, frankly, if we go forward with option number 1 at this time.
Okay.
So would be willing to make that motion.
Okay. Then we have a motion on the floor. Is there a second for alternative 1?
I'd second it.
Okay.
Do we need to, in the motion, designate?
Designate a couple.
We can.
Okay. I would.
That might affect the outcome of the vote.
Well, I think was it Supervisor Peters made the suggestion, maybe a soft suggestion, that Supervisor Kennedy serve on 2x2, or was it our chair?
That was me, but that's
so I'd be prepared to support that, especially given some of the concerns expressed by the supervisor.
And who is a second member interested in
was that a nomination or a change of motion?
Change of motion.
We're in the process of the motion is evolving.
Right.
Okay. I just was trying to follow.
I'm looking for a second.
I'd be willing to serve. Okay. And Ms. Peters wants to serve?
Well, it can only be 2, so.
Maker of the motion's fine with that. Well, that's kind of awkward, but
that's
legal.
Okay. So
who would be our second, or what's the preference for the second designation?
So there's 2 motions on the floor? Is that what you're saying, Phil?
There is 1 motion on the floor, which is
He seems to be shaking his head no. That's what I'm confused
There's 1
about.
motion on the floor to go with option 1 with designating the 2 people that would fulfill.
Which is Supervisor Kennedy and, at this point, Supervisor Natoli.
That would be my motion.
So is there a second to that? or there was a second, and I'm sorry, was that from you?
I would say that it was a friendly amendment, and
Okay.
that the maker of the motion
Agreed.
accepts that
Okay.
if the seconder does.
Okay. Then we do have a motion on the floor and a second. All those in favor say aye.
Aye.
Any opposed? Any abstentions? Motion carries. And go. We'll task the interim county executive with coordinating this effort. Thank you.
2 council members, 2 board members together, so.
Yes. Okay. Next item.
Item number 58 is for the board to consider appointments from their own ranks to various boards and commissions.
Okay, we're back to this item. It's in the information that the board members have before you that at our last meeting, the board requested that the following 3 items be brought back today. One is the County Leadership Advisory Commission for further consideration, and then second and third, the Adult and Aging Commission and Human Services Coordinating Council were referred to the chiefs of staff. The chiefs are working on getting a member for each of these boards, and the items will be brought back for our consideration as they find them. So we can proceed to I guess you'd call it a
Colorful
matrix. Does anyone, for any of the items that are in color that we have not one of the 3 I've already mentioned, anyone wish to make any appointment at this time? Any alternates or
Silence is deafening.
Yes. So not hearing any, that will conclude this item for today, and we can bring it back at such point in the future as we have nominations.
Madam Chair, excuse me, for the County Leadership Advisory Committee, it was the former county executive. Will your board consider making that be Nav Gill, the interim county executive?
Okay, I see that now. So, does the board wish to appoint Mr. Gill to serve as the designee appointed member for the County Leadership Advisory Committee at this point? Do we have a motion? Do we have a second? All those in favor say aye. Aye. Any opposed? Any abstentions? Motion carries. And I think that is it.
Congratulations, Mr. Gill.
For today. Yeah, I did not mention at the beginning of the meeting, but at the conclusion of our last board meeting, the Board of Supervisors did unanimously appoint Mr. Gill to serve as interim county executive, and that became effective on Sunday, January 24th. So, the next item.
Item number 59 are your nominations. You are continuing to February 9th, the Cemetery Advisory Commission, continuing to February the 23rd, the Sacramento County Mental Health Board, continuing to March 8th, the County Service Area 4B, Slough House and Wilton Consumnes, County Service Area 4C for Delta, Developmental Disabilities Planning and Advisory Council, Sacramento County Alcohol and Drug Advisory Board, Sacramento County Youth Commission, Southeast Area Community Planning Advisory Council, and the Vineyard Area Community Planning Advisory Council. For today's items, your first item is the In-Home Supportive Services Advisory Committee. Madam Chair?
Yes, the Chiefs recommend for a consumer representative seat, Kimberly Lathrop, and for a provider, for the provider representative seat, Deborah Hibbler.
And you would like to continue?
And continue the item to March 8th.
Okay. And for your final item, is the North Highlands Foothill Farms Community Planning Advisory Council. Ms. Peters?
I'd like to nominate Edwin Valdez as to that CPAC and continue the balance to March 8th.
Mr. Cerna?
Please continue District 1 till March 8th.
And Ms. McGlashan?
And the same for District 4. We have no applicants.
And that concludes your nominations.
Okay, we do have one off-agenda speaker who's been waiting patiently as well. I'll call on Mr. John Sorty. You have 3 minutes to address the board.
Thank you, members of the board and staff, to be here. Appreciate your time in advance. I'll get my glasses on so I can read it properly. I understand that the job of political system is to establish justice in a sinful and unlawful world. There's no way to maintain justice without the law. We see it every day. Laws are constantly changing to establish a social equilibrium of the forces and counter forces of our society. And the law, in its totality, is an expression of structure of government. I'm not requesting anything outlandish as changing the law for my yard, but for a little more tolerance in reviewing my request for time. I was here to discuss 3 issues. Last January, I came to discuss the code enforcement issue on my attached patio. A few weeks later, I met with Mr. Natoli and the staff, Mr. Robert Leonard and Ms. Moss and the group. At this meeting, I thought from Mr. Natoli I was grandfathered in on the patio, an attached patio. As you saw it, if the county fined me, they would have to fine every other household in the county, as most have an attached patio. At this meeting, it was also decided that I would take care of the site triangle issue with my fence and clean up what some term as junk and rubbish. Many requests were made to Ms. Lori Moss, asking for a letter stating that the attached patio was grandfathered in. I have not received anything to that effect as of yet. When Mr. Jared Wycliffe came out to the property, and the notice was for the side, back, and front yard, which I asked why the side and backyard had been added, and I was informed that Barry Chamberlain was told since it was warrant, everything was now on the table. So I'm a little confused with that and a bit frustrating to know if I'm supposed to comply with the hearing date as of March with taking it down or not. I'm not kind of lost on that. I understand Ms. Moss is busy dealing with the entire county, as well as the favoritism charges that have been hurled at her directly. But if it could have been noted somewhere in my file, I don't think I'd have to be here today discussing the site, the backyard and the patios, The site triangle, at the meeting with Mr. Natoli, it was explained to me that I would have to alter my fence to have a site triangle. Triangle to me was set back 10 feet on either side of the driveway. What I don't understand is 10 feet by 10 feet. I was understanding by Mr. Barry Chamberlain that as long as the site triangle was there when the driveway was being used, you could have the fence on the sidewalk 6 feet. So when it was brought back to open the driveway, which is what I've been trying to do, it is the site triangle. But now I'm understanding that I have to have it at all times. So no matter what, I'm a little frustrated with that too. So I think clarification on how that is supposed to be, so I do understand it entirely. I cleared that up. Junk and rubbish issue. When I looked up your definitions, junk and rubbish, any worn out, cast off, or discarded article or material which is ready for destruction or has been collected or stored for salvage or conversion to some use. Well, my issue is collected instead of paid for. I've paid for everything that's there. Rubbish includes, but is not limited to, waste such as paper, cardboard, grass clippings, tree and shrub trimmings, wood, bedding, crockery, construction waste, and similar materials. I will be the first to admit my yard is nowhere near complete. I admit I have wood on my property. I have construction materials, not waste. I'm not proud of the yard still not finished. But I've been waylaid by a site triangle issue in May of last year. Beginning my knees, I've been attempting to get my revisions done on my knees. Okay.
Mr. Sorty, can you
Yes,
wrap
ma'am.
up your comments, please?
I have about 2 more seconds, if that's...
Okay.
It's okay. So basically, all I'm looking for, if you want me to shoot to the end of this, I do have an okay now from state fund to get my knee revisions done. Been part of the reasons I've not been able to accomplish your schedule that's been put on me to get these things accomplished. I'm asking for some time to get my knee revisions done prior to having to have both knees replaced again. I do have an okay from the state fund. I'm trying to juggle their schedule for surgery dates and the county's schedule for me trying to complete this. Hopefully, with me getting the okay to do this, so I don't get fined by the county, I can get the surgery done and therefore be in better shape to actually accomplish this on the time schedule needed. So my request for more time is basically for the revisions to get my knees done. So I'm trying to juggle the county code, the time frame, and also the state of California for my knee revisions. So I would look forward to some tolerance and constraint on what I need to do here so I don't get fined and getting these done at the same time.
Okay, thank you. The board cannot take any action on your request because it is off agenda. I would refer you to Mr. Leonard in the audience, who is the agency head for the departments that you're dealing with.
That would be fine.
Madam Chair, can I maybe shed
Yes,
just a little bit of
of
light briefly? And Mr. Sorty did, he or somebody on his behalf, delivered a letter to my office. It was received January 16th, and I have actually met with Chief Code Enforcement Officer yesterday, Mr. Chamberlain. I know we have a request from somebody on your behalf to set an appointment, and I certainly was open to doing that. I would just note, without getting into much detail, but actually have a copy of an email that was sent to you, John, almost a year ago to the very day, January 27th of last year, by Mr. Leonard, that addressed the issue of the patio cover. I brought that to Mr. Chamberlain's attention because in that particular email, Mr. Leonard, at that time anyway, had said the removal of the shade or patio cover on the west side property was rescinded. And that was sent to you. I don't know whether you ever got that or whatever.
That might explain the problem. I'm one of those non-functioning, I don't get emails. That seemed to be, if you remember right, when I was supposed to be at a meeting at the board office and everybody was at my house because I got sent an email that they changed it without confirming it with me.
Okay.
I'm sorry.
Well, we'll get you a copy of that, John. And I say we hadn't followed up. I just want to let you know that, again, I think Ms. McGlashan makes it right. That certainly Rob and our code enforcement officer and folks certainly can have further conversation about your request. He did get a copy of the letter. I did talk to Rob last week as well. Okay. I was trying to coordinate a response because I know you wanted to have a meeting. And, again, I understood that the hearing had been set for March 15th, so I believe there was a little bit of time for us to communicate with you. So
absolutely, I believe that.
Okay. So I don't know about the extension for time and so forth. That's something that our folks have to take under consideration, but certainly aware of it. And as it relates to the patio cover, not to the rest of the issues, but certainly the patio cover, I think that had been adequately addressed at the time, unless there's been some other work on the patio cover. So why don't you get with Mr. Leonard, and my office will be back with you as well. I think Debbie, on your behalf, had called to set an appointment. We can set a time to meet.
Okay. Well, that'd be fine. It just sounds like there was a miscommunication between Mr. Wycliffe, and I'm not sure why.
Yeah, well, he was out. He was out on the 20th, and I have a copy of that as well. I got a copy of the letter as well.
So is it fair to say that the site in the backyard were added, supposed not to be added because it was missing?
Well, we're going to sort through that, but I just wanted to let you know I had a copy of communications related to the patio cover. It doesn't relate to junk and rubbish or to the side yard, to the fence and so forth. So we'll need to take this up again with Mr. Leonard and Mr. Chamberlain. Certainly, you have requested a meeting, and we'll get something arranged to have a meeting with you. So
that would be fine, and thank you for your...
Thank you.
Thanks, John.
Okay, next we have county executive comments. Nothing. Okay, any comments, reports, or announcements from supervisors? Okay, then
come to the Container Store opening.
You want to say
at
more?
How about Arden
Okay.
on Thursday.
Oh, okay.
For the first 2 days it's open, Saturday and Sunday, 10% of gross sales, or not gross, of sales, go to the Sacramento SPCA.
Oh,
so
wonderful.
it's a good cause.
Well, that should get Mr.
If you can't go to the
Natoli
opening, go
there.
shopping.
Okay, then we have 2 adjournments from Ms. Peters.
Yes, thank you. I do have 2 adjournments today, and the first one would be for Emery Townsend. Recently, we lost an inspirational figure, Emery Townsend, who triumphed over physical disability, demonstrating a tireless work ethic to family, friends, students, and work colleagues. Mr. Townsend was born on a Michigan farm and as a young man served our country during World War II. When he returned home, he contracted polio and was hospitalized for more than a year, but he was able to recover with an atrophied leg. Since farming was no longer an option, with his wife's encouragement, he enrolled in college under the GI Bill while raising a family and working multiple jobs. He later became a high school teacher and taught special education. Eventually, a family consisting of Mr. Townsend, his wife, their 3 boys, and 4 adopted girls, and one of the children is Dave Townsend, who many of us know. They left the Midwest in its harsh winters to move to California, where he continued to teach and coached football, a career in education consisting of more than 20 years. After retiring from teaching, he immediately went to work as a staff assistant at the political and public affairs consulting firm of Townsend, Raimundo, Bessler, and Usher, where he was an inspiration to the staff, working there for another 20 years. He stopped working 1 week before he passed away at 89 years old. I think his story illustrates that despite physical disability, one can achieve and enjoy the fullness of life through the warmth of family and friends and the rewards of work, career dedication, and individual initiative, and would therefore like the board to adjourn today in memory of Emery Townsend. My second adjournment is a little more unusual. Last week, the Twin Rivers School District Police Department lost its only canine officer, an 8-year-old Belgian Malinois named Jag, who'd been with the department for 5 years. He was killed last week during a routine training session when he somehow got out of the training area's controlled environment and was hit accidentally by a car. He was listed as a narcotics and apprehension officer, but this 4-legged officer with the wet nose also served as a goodwill ambassador for the department. He spent a lot of time at schools meeting children, which was a big part of Jag's job. School police department says he was probably the most popular officer in its department. Goes without saying. I personally met Jag when I was talked into a demonstration to show the dog's ability to apprehend a suspect. I got talked into donning a hardened plastic protective arm sleeve and waited for the police officer to order Jag to come after me, and he did. Jaw open, fangs showing, and it will be an experience I'll never forget. And I recommended to all that if you're a bad guy, give up if the dog comes after you, because it is quite an experience. So the Sunrise Recreation and Park District Master Plan for Cabana Park and Old Foothill Farms has a dog park component, and the Park District Advisory Board has been asked to consider dedicating the dog run portion to Jag. And also, residents of Old Foothill Farms are raising funds to place a memorial boulder at Pioneer Park engraved in Jag's memory, which would be near Pioneer School, where the dog visited and brought joy to the children. If you're interested in joining me in this effort, you can contact the Neighborhood Association at oldfoothillfarms.com. So we'd like to adjourn in memory of Officer Jag and Emery Townsend today.
And I, too, had the opportunity to meet Officer Jag and Rio Linda, although I did not get volunteered for the same activity that you did. I just got to pet him. With that, we will adjourn this board meeting to closed session in memory of Emery Townsend and Canine Officer Jag.